Distinguished guests, ladies and gentlemen, I am Owo Okiti, and I'm the Managing Director of Business the Media Limited. I am delighted to welcome you to our second annual Workplace Health and Wellbeing Conference. Last year, I remember very well, when we had our first conference, it was held at 4 Points at Oniru. At the conference, it was just discovered that Nigeria had the first index case of COVID-19. But even at that conference, no one could have predicted the experience we have had in the last 1 year. Since then, the workplace environment has changed in so many ways. And I would like you to permit me to highlight 5 ways which I believe it has changed. The first is remote working. The second one is online meetings and conferences. Everyone has now become very used to online meetings and conferences. The third one is we now have limited boundaries between work and home. And of course, the fourth one is we are finding out that new skills are required for the work of today. And the fifth one is the frequent changes to the work environment. But what this means is that it has implications for not only productivity, but it also has implications for our health and our well-being. And I believe that that is the reason why we have gathered here today. So as the theme for this year demonstrates, it is time to take stock. It is time to begin to understand the implications of the last year's experience for workplace health and the well-being of colleagues, co-workers, leaders, and families. This is especially important because there is still so much uncertainty about what the immediate future holds, but also because we may never return to the pre-COVID era in the workplace. I am therefore delighted that Business Day has been able to assemble great minds here and practitioners this morning to share their insights and experiences that they think will shape the future of the workplace and the implications for our well-being and our mental health. The conference is about analyzing the workplace in the last year and the lessons that we can learn from it for the future. No doubt, the experiences all of us have had are varied as the number of people in the workplace, but we can all learn from these experiences. We can all learn from each other, and that is why we are here this morning. Before I welcome Biola Onyejekwe, the head of Human Resources at BABS, West Africa, who is our moderator for the first panel, please permit me to thank all the speakers that will be speaking here this morning and later in the afternoon. They will be speaking across 4 panel sessions, and these are very, very loaded sessions that I believe that every human resource, every leader, every CEO will benefit from the insights that will be shared today. I also want to thank our sponsors for this event. We are very, very grateful to them for the support that they have given us this morning. They have Total Health Trust, a leading HMO here in Nigeria, Asad Mansard, a leading insurance company also here in Nigeria, and of course, Choose Life Limited. We want to thank you for your support, and we are very, very grateful. And for you, our audience, I really, really do hope that the time that you spend with us here this morning and later in the afternoon will be worth your while. Thank you so very much, and I really do hope that you enjoy your discussions. I would now like to hand over to Biola Onyejekwe to moderate the first panel. Thank you so very much. Have a great morning.
Thank you. Thank you very much, Dr. Okiti. Thank you for the introduction. A very good morning and a warm welcome to everyone joining us for this second annual Business Day Workplace Health and Wellbeing Conference. Like Dr. Okiti said, my name is Biola Onyejekwe. I am the HR business partner for BASF West Africa Limited here in Nigeria. BASF, as you may or may not know, is the world leading chemical company. We have our legal entities in over 86 different countries, and we've been in Nigeria for 55 years going on. So a warm welcome again to everyone, and thank you for joining us this morning. Our discussion this morning will be centered around our preparedness or lack of it as it relates to the COVID-19 pandemic. If this was to happen again, how are we better prepared? How have organizations coped, and what lessons have been learned from the data that we have gathered? Around the world, there have been more than 109 million confirmed cases of COVID-19 and 2.4 million deaths so far. However, pessimistic projections on the impact of COVID-19 on Nigeria and other sub-Saharan African countries in 2020 turned out to be alarmist. We have been cautioned that the new coronavirus may be the first of several disruptive virus global outbreaks that will become less infrequent in the coming years. Before COVID-19, the most recent case was the Ebola outbreak in 2014, like we all know. This makes it vital for us as organizations to identify what is working for us in tackling COVID-19's impact on our employees' health and well-being, and leveraging, of course, on our experiences as we prepare to batten our hatches once again if the infection figures spikes again. With me this morning are seasoned HR professionals and HSC professional as well, who have managed the organizations through the pandemic. I have the pleasure of welcoming our panelists for this session. The very first panelist that I would introduce to you today is Mrs. Busola Alofe. Mrs. Busola Alofe is the Registrar CEO of the Chartered Institute of Personnel Management, CIPM. Mrs. Alofe is a veteran HR management leader, an expert with management and leadership experience of over 16 years in diverse sectors and within many countries around the world. A very warm welcome to you, Mrs. Alofe.
Thank you. Good morning.
Thank you. Good morning. Our second panelist is Mrs. Folake Odegbami, Head HSC Lafarge, Africa. Mrs. Odegbami is a chemical engineer with an MSc in energy. For almost 2 decades, she has managed the HSC and security in several countries and across various industries. A very warm welcome to you, Mrs. Odegbami. Thank you for joining us. Good morning. Thank you. And thirdly, I'd like to introduce to you Mrs. Funke Anobi. She's country head, human capital, Stanbic IBTC PLC. Mrs. Anobi is responsible for leading, defining, and managing the group's HR strategy in Nigeria and oversees the delivery of HR services, policies, and programs. She has over 28 years of experience in various industries, including finance, telecoms, manufacturing, and technology. A very warm welcome to you, Mrs. Funke Anobi. Thank you for joining us. Well, you're most welcome, ladies, and thank you again for joining us. Let's get straight into it. We won't waste any more time. My very first question this morning, and I would like to direct this to Mrs. Alofe, in no particular order. Mrs. Alofe, please tell us or share with us from your experience. I mean, we've had the first wave of the pandemic has come. The second wave looks like it has peaked. What key lessons would you say your organization has taken from these breakouts? And if the third wave was to happen upon us, or a completely new pandemic, how would you say that you are better prepared for this? Over to you, Mrs. Alofe. Thank you.
Thank you. That's a really good question. At the CIPM, just like every other organization across the world, we experienced that pandemic in much the same way. Around this time last year, it was mainly still news from China. And then by the time we got into February, we started to hear that it had spread to certain countries. And then we had the first case in Nigeria. And we were watching the news. We had never experienced a pandemic, but we had heard about the 1918 one and a few other cycles of maybe not as deadly since then. And so we braced up for what would happen. I remember having conversations with my leadership team in February, and we were saying, listen, this is a pandemic, it is going to get worse, so we have to prepare. And because it was such a deadly one, at that time it was largely projections, focus at the CIPM shifted very, very quickly to focusing on health and safety, protecting lives, making sure people were safe from a health and safety perspective. That was quite novel because a lot of what we've historically done has been around HR, people management, all the activities with that and processes. So really bringing health and safety into the middle of focus was one of the very first things we had to do. And inadvertently, in January, we had been connected with the Institution of Occupational Safety and Health Professionals, IOSH, which is the world's leading association of health and safety professionals. We have started talking about partnering on health and safety, integrating it with what HR professionals do, and we were forging a partnership. Leading from those conversations in January, we had started doing our health and safety audits in our own organization, not knowing that COVID was coming. We had engagement sessions to sensitize and create awareness amongst our staff, much more so about the importance of that focus on health and safety. So when the pandemic, when COVID started spreading, we just latched onto what we had done in January and February and continued the engagement sessions. We were also learning from a lot of what was being shared all over Nigeria and indeed from all over the world. So lesson number one is the criticality and the centrality of making health and safety foremost. Two, very, very connected. In fact, at the same primary level of focus is the centrality of people to an organization. People are the most critical assets because people make all the other assets sweat and deliver value. So the second thing was really making sure that we demonstrated through what we said, what we did, that people are important. Third was partnerships and collaborations. So we started a series of engagement sessions. We invited, leaders from different organizations to the panels, just as you're doing today, on various topics that we had distilled based on what we were sensing all over about what is on the minds of people. And we became a channel of engagement. So those engagement sessions, both internally and externally, we started to do a lot of those. And they were very valuable because we learned, other organizations and other individuals also learned. Fourth, we had seen that the pandemic was really going to disrupt, work at the government level, at the organizational level, individual level. And because of the deadliness of it, about 2 weeks before the Lagos state government and national government, federal government rather, shut down, we actually shut down here. And, we very swiftly moved to working from home. Well, we could do that because we're a service-based organization. We're not a manufacturing plant or anything. So we might say maybe it was a bit easier for us and it was easier for us to really speed up, but we did that. And, immediately providing the resources, the tools to our employees to work from home. We doubled the data allowances, we doubled the internet allowances, knowing that they would have to use much more of that than when we're physically in the office. And we started, the fifth thing, really started having virtual connections. So a lot more, we call them family fireplace conversations. We're going to have a family conversation, family huddle. And we started having those just to check up on people, make sure they're okay. I remember when the Million Boys saga was unfolding last year. I mean, our staff live in a number of those areas that had a lot of security risk. So being there to support them, to calm them down, and then also taking action through our networks with the government to support them. We did a lot of that last year. And I'm sure this is very similar to what a lot of other organizations did. So essentially being proactive, focusing on health and safety, making sure people were well cared for, making sure they could work, they could deliver, making sure they had what they needed to be able to perform, staying connected, and still getting us to pay attention to the agenda. But one of the other big things was our speed to agility, because very quickly in the year, we transformed our business operating model. from being predominantly face-to-face and physical gathering denominated to being virtual. And we started to change our programs, our frameworks, and all the different processes associated with delivery, because we had only one other option, and that was shut down completely, shut it down. But that was not an option that would make any business sense. So we had to focus on reframing, revamping the operating model. We were able to do it successfully because there was absolutely no activity that we normally used to deliver in the year that we were unable to deliver last year. And we even got a lot more recognition, both globally and nationally, from our activities. And we started to see increase in our impact and our reach and all that. So these were all very, very important activities that we went through last year. And those lessons and learnings have stayed with us, because as we started 2021, my view was, having seen the resurgence in the cases and the different variants of the virus, we started the year saying 2021 will be another COVID year. And so all those lessons we had in 2020, let's replicate. So the sixth thing is really just those lessons learned and replicating them in a fit for purpose way. There's a part of me that thinks maybe the second half of 2021 will not be as bad as we think, but I'm not sure, because we keep seeing variants. I mean, people sadly are still dying, which is very painful. But again, I've seen data that says the number of cases is declining both globally and in Nigeria. And really nice that there are vaccines available now. So we'll see how it pans out. Let me pause there. Thank you very much for the question.
Thank you very much for those lessons. I mean, you really, really captured them. I was able to capture a few, but it's the fact that you quickly recognized in the organization, the speed to agility, quickly, sending everybody off home because you had to shut down. Everyone had to shut down, but it did not stop your business. And the fact that you doubled data, you made it convenient for people to work efficiently out of their homes or home offices, wherever they're set up. Thank you very much for sharing that. I think I have quite a few lessons as well. And we would always come back to you to please share those lessons learned. It's important as well that, the lessons that you learned in your organization, you documented, and then you want to start the new year from there and saying, what does 2021 have to hold for us as it relates to the virus? Thank you, Mrs. Alofe. I appreciate that. Thank you for sharing with us. Okay, just to remind our participants, our audience, that they could contribute by dropping questions on slido.com, #WHWC. Again, to participants, please contribute by dropping your questions on slido.com, #WHWC. Thank you. All right, my next question I'd love to direct and get her perspective. Mrs. Folake Odegbami, this question is for you. Please share with us. How did your organization manage the health risks and realities of COVID-19? Is there a pandemic response strategy in place, especially as it affects the health and the wellness of your employees? Thank you. Over to you, Mrs. Odegbami.
Okay, thank you. Just to say that in case we have forgotten, unfortunately, the first person to be confirmed in Nigeria landed in one of our facilities. So for us, it wasn't something that we read in the news. It was the life that we lived at the time. So I think quite a number of things played to our advantage. The first being that we had, our health and safety management systems in the place, regardless of COVID or no COVID in any case. So that has always been part and parcel of what we do in our organization, being manufacturing facility and all of that. So in actual fact, we have clinics that are managed by, proper health and care organizations in all of our manufacturing facilities as well. So for us, we had that advantage of a good level of preparedness. So one of the things that we also hinged on was the fact that back in the days, there was Ebola also in Nigeria. And so a lot of lessons learned from that. So in terms of having isolation center, a decontamination process and all of that. So even beyond Ebola, so we still kept some of those practices alive, so that when this situation then happened, we didn't really have to scramble from the scratch. So the first case that came into Nigeria, and just going back the memory lane now, it was the consultant that had come into our facility, but because our clinics already had a system in place, there was a high level of suspicion once this person presented with those certain symptoms. And so it was just straight to the reality of, you have had a drill, now this is the time to do it. And so the doctor at the time quickly suspected and said, look, I think this, even though it hasn't landed in Nigeria, but she was quite adamant to say, based on all the things they've been taught, all the trainings, all the preparedness, this sure do look like COVID. And so all the calls were made. We had to pull in all the relevant government stakeholders, the NCDC, the two state governments that were involved at the time, to say, we think we have somebody here who has presented these symptoms, and then we would like for the person to be tested. So in fact, none of the state governments were even ready at the time. So it was a lot of scrambling but then eventually we were able to safely transport this person to their facility. And so it was tested, unfortunately confirmed positive at the time. And immediately we had that suspicion as well. We had started the contact tracing, to look at what areas of our facility he had visited, who were the people that he had contact with. And so we had all those provisions in place. We had our isolation rooms ready. And at the time, we had to shut down one of our guest houses because we had to isolate 40 persons, at some point. So we had a lot of support from WHO and NCDC. And this is again leaning on the fact that stakeholders' engagement also is quite important. So because we had those relationship with them, so we were able to quickly call them in. And so it was quite a seamless process. It was scary though, because it was new. Not a lot is known or was known at the time about this virus. There was the thought that it could be as contagious as Ebola was. So it was a whole lot of things that we needed to do, shut down part of our facility, and but at the end of the day, again, because we were able to learn from the past, because we have a very strong health and safety culture, which is part of our own life in any case, regardless of what happens in the world. So we were able to quickly just tune into that, manage the situation. And even beyond that first case, we've continued to build on our infrastructure, on our knowledge. We continue to run training sessions with our people, awareness sessions with our people. We continue to also run desktop pandemic exercises, what we call it. Even from that first incident, so we look at, if it then becomes a nationwide situation, what are we going to do? If a second wave comes, what are we going to do? And so at each of the stages, when those realities came, we again had some ideas of, this is how we're going to respond. So it was never really a difficult situation to manage. And, we continue to learn from the past, continue to build on the structures that are in place, continue to look at what is happening around the world, and then using that to predict what do we need to also have in place to continue to respond. So I think in terms of the overall picture, that is the approach. So health and safety is a part and parcel of our organization. It would continue to be even beyond and COVID. So it's again just to continue to build on that process.
Great. Thank you so much, Mrs. Odegbami. You had firsthand experience with COVID. We can't forget that. I don't know how that skipped my mind. So of course you learned a lot from the experience. Having firsthand the first person in Nigeria, and that doctor that stood her ground saying, this is what I've learned, this is what it looks like. We are really, pleased with the way it was handled, because of course it could have gone south. So kudos to you and your team, and thank you for sharing your experiences with us. Thank you very much.
Thank you.
All right, again, just to remind our participants to please contribute by dropping your questions on slido.com, #WHWC. Thank you. Thank you again, Mrs. Odegbami. Okay, I would now be directing my question to Mrs. Funke Amobi. Stanbic IBTC is a multinational across many states in Nigeria, many countries in the world. Could you please share with us, ma'am, in your organization, do you cover the full cost of private facility for COVID-19 testing, or are these costs shared with your employees? Does your organization have plans to introduce frequent testing? So please share with us your experience so far. Thank you, ma'am.
Thanks very much indeed. And just to set the tone before, answering the question specifically around testing, is to say that as the pandemic rolled out, of course, as we all know, extremely unexpected, and no one was prepped for it. We had approached the entire subject holistically in a structured manner. So we called it the 3R strategy. So we had first rapid response, and then we moved on into resilience. Rapid response first, resilience response next, then recovery response. So in the staged manner, we had what you call a cross-functional team that was responsible for ensuring that each phase of the response was effectively managed. So to start with, it was just everything had to be done rapidly as the pandemic broke. And under rapid response, what we had to do in the 3 phases, effective communication was the biggest part that leadership took ownership of. So all communications came directly, or the major communication came directly from the CE directly to all employees. At the beginning of the pandemic, the CE was writing every other day to employees. And then it became twice a week to employees. Then it became once a week to employees. You knew that every Friday, until very recently, you would get a comms from the CE on the state of the nation, in quotes, the COVID-19 pandemic nation. And so for us, this helped manage all the exigencies. And in the first phase, which is where I believe your question indeed lies and cuts across anyway to resilience, to first respond rapidly was to look after our employees' well-being. So employee well-being management was big in the first phase. We've got a wellness desk, i.e. we have a medical consultant that runs a wellness desk within the human capital team. So that team became very, very critical. In the crisis management team, the medical consultant had a seat, and if you like, was almost as important as the chairman, in that conversation daily. So apart from communication, the biggest part of it was employee well-being management, profiling employee risk. We had to do a very big exercise again to reprofile employee risk. Of course, we had to activate remote working as part of that rapid response, which is what everyone did. We had to worry about business continuity management. We had to worry about the people risk, which we reprofiled, the biggest of which was well-being. Now, well-being for one, working at home, and well-being for secondly, COVID-19. So in COVID-19 well-being management, we focus essentially on first, information management, ensuring that everyone was informed. You had to be informed about the virus first. We didn't know what I feel almost like a veteran now on the subject because you've taken in so much. But at that time, it was pure vanilla. Everyone was, nil about the subject. So we kicked off a complete information management process, ensuring every employee was informed. What is this we're dealing with? What should you be mindful of? What do you need to do to respond as an individual and for the organization to respond for you as an organization? We called it the Taking Responsibility Campaign. So we broke out the Taking Responsibility Campaign so you all know exactly what COVID-19 is all about. We installed a COVID-19 app for our people. And on the app, you would find all the information you require. So the app had 3 functionalities, mainly, it had others. So there was the information part of it where everything, it was being fed directly. It's a Standard Bank Group app, COVID-19 app for all operating countries. So it fed all the information from WHO, all the information from across, the country, NDDC for Nigeria and for all the other countries got fed into the information portal. So on your app, you could go there. Secondly, it had what we call symptom checker. Your symptom checker is a set of 10 questions, which you get to ask yourself every morning. You should ask yourself every morning, technically. and we've been working from home. I'm seated in my home office, which is where I've been since March last year, more or less. You check the 10 questions, and if you answer yes to any of the questions, then you activate another button, because it then means that there may be a concern for you to do a test. So I'm getting to the question on testing. So the symptom checker enables you, find your feet around. Then the third focus area we zoomed in on, as far as employee well-being management for COVID-19 was concerned, was to break up the workforce into what we call the vulnerable work groups. We identify the vulnerable work groups, because for the different set of people, COVID-19 maintenance meant different, different, if you like, activities, and if you like, different exigencies. So vulnerable groups identified, communicated to the business, communicated to all employees, and you were encouraged also to declare if you belong to any of the vulnerable groups. So if you have any of the underlying conditions you're managing, we all get to manage one thing or the other. You're managing high blood pressure, you're managing diabetes, you're managing anything. Or if indeed you are a patient that is dealing with a bigger health concern, i.e. cancer and all of the above. So we identified these vulnerable groups. And in identifying them, we work with two health providers, one of whom is in this program, as I've seen, THT, Liberty. We also work with Axim and SAD. So we worked with both. We requested our staff members to grant authority to our medical consultant to have access to their medical records as vulnerable staff. So the providers had the authority of such employees to provide the medical records to the medical consultants. What that meant for us was we had to treat those people specially. Don't forget, we're a special service organization. In other words, whilst the lockdown was in force, Stanbic IBTC, like other banks, needed to be at work. We were opening the branches. So some people had to go to the branches to work, and we had a special arrangement for them. Whilst those people who were defined in the vulnerable groups, and pregnant women were in the vulnerable groups, by the way. Those married to people in the front line were also in our first line identification of vulnerable groups. My husband is a medical doctor. My wife is a nurse, and all of that. We identified all of those people. So firstly, you had to be excluded from managing from frontline. So you wouldn't go to the branch, you wouldn't go to the office. You would have to work from home, even if your skill pool was required to go to the office. So that helped us manage that space, people risk management being redefined. Down to testing. Once we get to the subject of you do need to be tested, the organization takes absolute responsibility with no shared costs for testing. Now, because we have a medical consultant in-house, it's easy to know who to call. We then also requested support from our support doctors, and we put in place what we call support doctors. So the support doctors was like a helpline. There were 4 support doctors spread across for each region. We had for North, for South, for West, because indeed our medical consultant, Dr. Jato, soon became overwhelmed. And it was evident that he was overwhelmed. On the daily calls, we could tell. So we then, called for these support doctors and set them up. And the communication from the CE that was going out every day at the beginning ended with a constant rider line. You feel unwell, call Dr. Jato. We were so clear. Our COVID protocol is so clear, and the organization makes it like a Bible. You must adhere to it. You feel unwell, call Dr. Jato. If we find out at the end of the day you didn't call Dr. Jato, it's almost like, why did you do that? You call doctor or you call the support doctors. So once you call the support doctors, they all were on a WhatsApp group, and I was put on that WhatsApp group as head of HR, and we could see immediately, oh, somebody is calling for this, and activate. So we were working with government centers, working with the NIMR Center at the very beginning, all the approved centers, and then we opened up to the approved centers like Medbury when they were, when we then had 6 additional Paylon. We established direct contact with these people so that if our people need to get tested, they get tested immediately. If you feel unwell, you feel you've been exposed in any way, or anyone, the guidelines said, anyone in your immediate family environment gets COVID, please contact Dr. Jato. So the protocol is defined. The protocol is so defined, you get tested. If, for example, you had gotten yourself tested privately, maybe your husband was getting tested, you also got tested, our rule book says inform Dr. Jato. Immediately you do a COVID test. So the protocol is clear, so we know who needs to be tested, and everyone gets tested. If there's any exposure in any of our locations, concerned employees immediately receive an email from Dr. Jato, an arrangement is made, and they get tested. So the short answer to your question is, the organization takes absolute responsibility financially, also emotionally. We've got the employee assistance program in place where we've got psychologists on ground to speak to. So immediately you get tested, we trigger employee assistance program. The psychologist will get in touch to talk with you to be sure that you are psychologically prepared and managed for that process. I think I'll stop at this point. Thank you.
Thank you very much, Mrs. Amobi. Thank you for that. I think we would all agree with me that every organization needs its own Dr. Jato. So please, if you don't have a Dr. Jato in your organization, I think it's apparent that we need one. Someone for our people to talk to, someone for our people to relate with if they have any issues or questions regarding COVID-19. Even though it's been with us for a year, some people still don't understand, how it spreads, or fully understand the virus. I don't think even the doctors fully understand it. We're still learning every day with the different variants that we have, but it's important that we have a Dr. Jato in our various organizations. Just to summarize what she said, I like the 3 R's: the rapid response, the resilience response, and the recovery response, and the fact that all these responses were tied together through effective communication. Thank you very much, Mrs. Amobi. Thanks for that. Okay, just a quick reminder again to all our participants to please contribute by dropping your questions on slido.com, hashtag WHWC. Please drop your questions, and one of our colleagues would pick it up and send it to us to share. Okay, I'll go back from the top. I'll go back to Mrs. Alofe, and this question is for you, ma'am. Social media and word of mouth have posed a challenge around COVID-19. Not so long ago, the governor of Lagos State, Babajide Sanwo-Olu, said that malaria-like cases should be treated as COVID-19 unless proven otherwise. Heated disputes on the efficacy and the dangers of medications such as hydroxychloroquine are still fresh in our mind. From an information welfare standpoint, how has your organization deliberately raised awareness among employees about COVID-19? I think you touched a bit on it, but please, we're asking how your organization has deliberately raised awareness among your employees about COVID-19. Thank you. Over to you, ma'am.
Thanks. I think my dear sister, Mrs. Amobi, she's touched on quite a few of the kinds of activities around communication and engagement. The whole thing around essentially the spread of fake news and the dangers of that, it applies even well beyond the context of the pandemic. It's, a general thing, whether it's, looking at the lives of individuals, people, you wake up and there's a story about this person or that governor or that person or that situation, which we are not personally a part of. And the question is, who do we believe? What do we believe? So one very important thing is fact-checking stories. The way we dealt with communication during the pandemic, very similar to what we've heard from Stanbic IBTC, was leadership being very visible and very present. That's important, because my favorite definitions of culture, the culture of a place, is one, it is what leadership allows, what leadership does. And second, it is the way things are done around here in our organization. So the leader, number one, right from the CEO, I really love the examples from my co-panelists in their organizations, being present. At the CIPM, we have a WhatsApp group where we have all employees. So we're not as large in number as many other organizations, but there are platforms. I mean, Telegram can take care of thousands of people, and there are larger platforms if any organization wants to use that. So we have an employee WhatsApp group where, we joke, we play, we celebrate, and we share on that platform. So immediately we saw what was transpiring. It was very apparent that leadership had to be very present. So that's myself and the team reporting to me. Essentially, we'll call that the EXCO. In the CIPM, we call that the top team. We implemented our business continuity management systems. We also made sure we activated our crisis management team. And we met and discussed what was transpiring and what we were experiencing every week at a minimum, and sometimes more than once, based on what we needed to get done, what decisions we needed to take. And we made sure we were communicating very important information to all staff so that we all heard it at more or less at the same time. So the WhatsApp platform became a very, very good place for sharing information, particularly information that needed to be read or information that was very important for people to get a grasp of immediately. That was one channel we used. I mentioned earlier that we had fire camp meetings, family meetings. So whenever the CMT met, or the top team, and we identified some very important action, for example, when we were going to go on lockdown, we had a family meeting. We talked about, look, we are going on lockdown. It is probably imminent that the government will do this, but we don't see any need for anybody to expose themselves to the propensity of contracting the virus through having to get in public transportation to come to the office, when what you can do as effectively from home. So we had that conversation, we decided, and we then held a family meeting to talk about it. Then we had a brainstorming session, and we started to ask ourselves, okay, what do we need to do to make this comfortable, to make this convenient, to make it work from everybody's perspective? What ideas do we have? And we were asking the team, the family, to say, is there anything that makes you uncomfortable about what we're about to do? So we got all the perspectives in that huddle. And I particularly enjoy huddles where everyone can be in the same space at the same time, or get information at the same time, so that people are not hearing information through third-hand accounts by when maybe something has become distorted by someone's perspective or whatever. So we try as much as possible to make sure very important information we get at the same time. Third thing that was going on, we were also having all of these learning sessions, because we were experiencing it new, like everybody else. So all the webinars we ran last year, we were inviting thought leaders. I'm sure, Mrs. Amobi was on one or more. We invited, health and wellness specialists, particularly those that are really specialized in mental well-being, mental health. It became quite a topical one, more so than prior to 2020. We had seminars on mental health, what that is about, employee assistance programs, and activating that. And we made sure all our employees had access to those events, make sure you're there. There are learning events. You pick up a tip or trick or two that you can apply. Again, there was so much being shared on social media last year. Everyone was sending some document or other, some article or other, some story or other, which was good, but there was also fake news. So we kept emphasizing to everyone that make sure the sources of the content we are digesting is coming from credible sources. So for the COVID-specific content, NCDC, World Health Organization, maybe one or two others, make sure that whatever we are taking action based on, the data is coming from legitimate sources. And then for stories and exemplars from other organizations, then make sure these are organizations that are legit. And we can place a call to and check for more information and so on. So in terms of engagement, these were things that we did to make sure we were all connected via communication channels and discourse. In addition, last year, we also maintained the connection, because it can become a little bit remote if people are not congregating physically. We also introduced learning sessions. We call them lunch and learns. And we said, each person, you're going to make a presentation to us once a week. Somebody will volunteer. Pick any topic, anything that's of importance to you. It could be business related, it could be COVID related, it could be anything. Help us learn. And so it was very interesting, some of the topics that came up. For example, we had one talking about the use of technology tools. in virtual context, security risks, exposure, because we had all gone virtual, we were all on Zoom and so on. And, we learned a lot from all of those things. And as well, our leadership extends to our governing council, who are not staff of the HQ, the organization, but they are the leaders at the highest level of the organization. And, Mrs. Amobi is one of them, really, really valuable leader, and so many wonderful other people, our president, the vice president, the national treasurer, many state branch chairpersons. We maintain contact and connections with them as well, because it's almost like bank branches, where you have a bank branch in different cities or different states. We have something like that as well. And we did everything we could through similar channels. All the branch chairpersons, they also have their own separate WhatsApp group. And we had forums with them a number of times last year as well. And we have an extended workforce as well. So a lot of our projects and activities are done by volunteer members. And we have committees that help us with different aspects of what we do. So we maintained contact with them as well via various channels. And of course, we encourage people to read the news, legitimate news sources, that is, and just stay on top of what's going on, but particularly be very careful the sources of your information. Thank you.
Thank you very much, Mrs. Alofe. Thank you for sharing. And again, you stressed that very important and valid points that the leadership or the management need to be at the center of the communication. It's important that you, at least from as best as you can, guide what your people listen to or what your people hear, and let it come directly from the top, top to bottom. Thank you for sharing. You also mentioned about, different WhatsApp groups and different avenues and channels that you use to share the information across your organization. Very valid. Thank you very much. So you guys within your organization, you deliberately, created the awareness and engagement of your employees. Fantastic. Thank you very much. Mrs. Alofe, I'm going to come back to you because there's a question here for you from Slido, and it says, as an institute for personnel management, what regulations and policies have you done to help people in terms of working from home? I think you mentioned that a bit already, but this question is for you and it just came through. Would you like to please reiterate?
So in terms of policies, and processes, one was just ensuring that you're getting information from legitimate sources. That was those are some of the processes that we brought in terms of how information is communicated and shared. Then working from home, that was a particular operating model that we introduced last year, and the support around that. In addition, we actually created COVID-19 protocols for the people working from home, because the truth is our lives became much more of a continuum from work to home last year than it was ever before. If someone caught COVID at home or was exposed to it and they were coming to the office every day, then the propensity for contagion became exemplified and really much bigger. So everything that we were advocating that people do at home, at work rather, we were advocating, and we are actually insisting, although it's not something you could actually track minute to minute, but we were quite insistent that these protocols remain the protocols that you deploy in your personal environment at home for your safety. And we emphasize that it's for your safety. We want to protect lives, we want to protect health. And importantly as well, the government regulations. We are a compliant organization. So another regulation was around whatever the government says we can do and cannot do, we must comply. So we had our own COVID-19 protocols document that had a number of policies stipulated within that and things that had to be complied with. In addition, we created our crisis management and business continuity frameworks as well that identified all the processes, not necessarily just COVID, but health-related, disaster-related, as FA puts it, the resilience part, the recovery part, and all that we captured in both the business continuity management and risk management frameworks that we deploy and track. And particularly, we started to work with a risk management matrix. And as you can imagine, health and safety was one of the very, very critical ones that were identified. And we were tracking that on a very regular basis. So for as long as we were working from home, we had significantly eliminated contact, physical contact. And while we were on lockdown, we also communicated to the membership at large that our physical locations are locked down. We're not going to allow anyone to come in. And then when the government reopened, we actually decided to reopen partially. We didn't reopen fully. And we communicated all of that as well. So there were clear processes. We wouldn't allow more than 6, I think, external persons into our headquarters at a time, and only 2 inside at a time. You know, things to that level of detail were communicated in addition to the opening hours and the mandatory use of masks and washing hands and, you know, sanitizers and all that. So we did all that. Thank you.
Thank you very much, Mrs. Alofe. Thank you for sharing. I think this also cuts across most organizations. You know, we all had to adjust. We all had to adjust our regulations, our policies, even in terms of, you know, sick leaves and things like that, leave policies. What do you do if someone was to be exposed or went into self-isolation? All of that, most organizations had to, you know, adjust, amend, have sessions around, you know, open up panels, and, you know, just to make, you know, the life of the employee better and more convenient at this time. So thank you again for sharing, ma'am. Really appreciate that.
May I add one little thing? It's very important because the question was about regulations.
Yes,
so
please.
In all the stories that were going on last year, it was becoming very clear that policies, HR policies and the execution of them, how we treat employees during disruption, it was a big conversation item. So one of the webinars, I think a couple of them, we actually brought employment lawyers together and we brought business people together to share the experiences and then have the lawyers give us advice in terms of this is how you handle this situation. As an organization, as an employer, you should not wake up and terminate employment or adjust contractual terms without having engaged with your workers. For example, I mean, there's so much in that space, but I thought it's important to emphasize that. So we brought the employers, the employment lawyers to the table to educate all of us and share, and then, you know, create access to them. And, you know, also to us to get advice and guidance in terms of specific contexts and experiences that different organizations were having. Thank you very much.
Thank you, ma'am. Very important and valid points. Thanks for sharing. Please keep your questions coming through. They are sending them to me. Please keep dropping your questions on slido.com, #WHWC. Thank you very much again, Mrs. Alofe, for answering 2 questions back to back for us there. Thank you, appreciate that. Okay, my next question, I would like to direct this question to Mrs. Odegbami. Resilient public health systems are critical to defeating pandemics. In this regard, groups like the Private Sector Coalition Against COVID-19, the CAR-COVID, have stepped in the breach to support the government. On a more permanent scale, what are the risks and challenges that you think of these interventions? Why do they not control the government or the governance of funds and contributions in kind? How is their support monitored to eliminate wastage and diversion of this support? I think basically this question is just saying, you know, we've had the interventions of the CAR-COVID, but on a permanent scale, you may not have the full answer to this, but just to get your own perspective of, you know, having interventions like this, what do you think, you know, will be the future if we don't have interventions like this, and if they cannot control the governance of funds and contributions in kind? Over to you, please, Mrs. Odegbami.
So that's one very interesting question. So, and maybe just to start from saying that, you know, for some of the concerns that you mentioned and some other reasons is probably why as an organization, we opted out of the coalition. And so our own approach was a lot of the things that we needed to do in terms of CSR, we didn't directly. We reached out to the communities, where we operate. A lot of donations in ambulances, isolation centers, and what have you to the different governments also where we operate. So we took a more direct approach of the intervention because of maybe some of these reasons that you have mentioned. But, even beyond our own situation, the problem of our country, we all know, so there's a really, really huge gap in terms of the infrastructure, in manpower, human capital for the medical space overall. So if we now take out even the little, however little it is that the coalition against COVID has done, it will be a huge, huge, huge problem for us in coping with the pandemic. I don't know how much in specific terms of the Naira and Kobo that has been spent, but if you take that out of the equation, I'm sure we would have struggled as a nation to deal with the pandemic, because there's the rot in the health sector. As we all know, there's a huge gap that needs to be filled as quickly as possible. Whether the budget is available or not is a different conversation. But healthcare has to be a priority for any nation, any organization at the end of the day. Unfortunately, Nigeria is where we are now. So I want to believe that on the part of the government, they are grateful for whatever, grains, rainfall, whatever it is that comes from wherever. So they would always welcome that. In terms of sustainability, it may not really work out long term. In the last 2-3 weeks or so, if I'm right, we've seen members of the coalition have disagreements over some issues that probably should not have escalated to that point. So as to how they're able to coexist in a much longer term and do what they're doing in whatever form it's going to be, or maybe the form or the dynamic will change, we really don't know. It will be left to the people that are really behind the closed doors within this setup. But the reality is Nigeria has a lot of work to do. Certainly. In primary healthcare, in secondary, in tertiary, in whatever area you want to look at, there's a whole lot to do. We continue to have organizations donate today and tomorrow. I mean, even as of today, we're still trying to build a healthcare center for the Ogun State government, which is again one of the areas where we operate in conjunction with one of our, multinational partners who are also in that sort of area. So, but it really will not be able to solve the problem, in my own opinion, because there's so much that organizations can donate here. There has to be the bigger picture of what is the plan for the healthcare system in the country. And how does it become a priority for the government? And how do they then allocate all the funding required year on year? Because it's not something that is done one time and that's it. If you build a hospital today, in 5 years, it's probably going to be obsolete in terms of the equipment. The workers will need to continue to update on what they know. We need to continue to train them. And that's why we have a drain in Nigeria now. There was a sort of emergency call in the papers that doctors and nurses are leaving in droves. What can the government do to stop them? I don't know. I really don't think that it's going to be a personal choice at the end of the day. But it has to be attractive for them. It has to be safe for them. It has to be comfortable for them. And those are things that are lacking that a COVID may not necessarily be able to solve, however they want to try. Because there has to be the map, the roadmap, the overall picture, how things fit into things. In terms of 5 years, 10 years from now, what would be the need for us in terms of doctors and nurses and all of the medical and auxiliary professionals? Are they being trained today? Or is it going to be 10 years down the line, we discover that we don't have enough number of persons enrolled to study these courses? What will be the population of the country at the time? So what will be the need in terms of hospitals? So it's a whole lot of things that the private sector will not ever be able to solve.
Definitely.
So
Definitely.
the private sector can support the government, but largely it's a lot of work that we need our government to really speed up and start doing. So if I may just,
thank you very much.
On that note.
Thank you very much for your contribution. I mean, it's from your own perspective. Again, it's the bigger picture that we hope the government will get someday, but we can only do our own, we can only add, our own contribution in our own little areas that we can. So thank you very much for sharing and sharing your perspective on that question. I'll move very quickly because we are fast running out of time. We have a question here for Mrs. Amobi from our audience, and the question goes thus. In view of the current realities and shifts to remote work, what is the future in terms of the number of workers organization like yours have? Ultimately, will there be a need to reduce staff number?
Thank you very much for that question. When the entire, when the pandemic broke out and digital remote working and all of that, and this same sense came into the environment. At the group level, a Standard Bank Group, the response was direct to say that, because what you had to do was to calm everyone down to say, we are going absolutely remote, we are going digital in line with our strategy as a business. In any event, we're driving a digital transformation. And at that time, it was addressed spontly to say, listen, guys, we're not doing any downsizing. We're not letting go staff. The numbers are not, the target is not to say, we're going remote working, and as such, people would have to be laid off. No. So when we go, what is the implication for, I'm going to now, so I've answered that question, specifically. I'm now going to answer the question as an HR professional. Putting on my HR cap, the future is digital. When I say the future is digital, I need to know how many of our audience members haven't touched their mobile phones today. Technically, there'll be not one person standing. What that means is that constantly, some of you have done even banking transactions on your mobile today. Some of you have done other retail transactions. You've bought things, you've done anything, you've conveyed things, it's a matter of do-it-yourself convenience. What that means technically is that human resources like you and I should get digitally future ready, digitally savvy, should acquire digital literacy skills for your employability index to be at its highest. So what we are doing is upskilling people, retooling people, ensuring that we've got a big investment in digital upskilling, a very big investment in enabling people, become the fittest they can for what has come upon us all. Listen, remote working came overnight, invariably. Overnight, literally. We all shifted our thousands of workforce into our homes and all of that. We've got in the Standard Bank world access to what we call the sales force, and every employee is encouraged to become a ranger. Becoming a ranger means 50,000 points of learning on that platform, enabling your digital literacy and awareness and readiness to adapt. Are we becoming a lot more digital? Remote working is an activity, is just a place to work. The most important part of this conversation is that work has moved to the digital platform. Work has moved to the cloud, to the digital platform. It's not remote working. I'm working from home. I'm working from the village. Or I'm working from anywhere else. That is remote working. But digital working is what COVID-19 has accelerated, which is the future of work we thought was coming in how many years to come. It's upon us now. So the implication for today's workforce is to ask yourself, are you future ready? How digitally relevant are you? So the short answer is, no, we're not laying off people as a result of remote working. The second and long answer and more important answer is, yes, we are making people more digitally proficient so that the reality of where business today and work today needs to be done, that has come upon all of us, which is at the digital level, will become BAU. And the average worker today should have a very decent suite of digital skills. So whatever it is, you are plug and play. I'd like to, I apologize. I took that opportunity to drive in that very, very important and I consider vital, thread in this whole conversation of remote working. Energies should be diverted in the right direction, not in the direction of working remotely. Are you going to need less people? No, you're going to need digital skills and digital proficiency. And that's what everyone should be hungry. Organizations should take the responsibility to provide the platforms to upskill people, which is like what we have done. And then individuals should take on that hunger and thirst and run after improving their personal digital literacy proficiency. I apologize. The focus is covered.
Thank you. Thank you very much, Mrs. Amobi. Thank you for that. I mean, we've all heard it. We should be rangers and upskilling ourselves. I mean, she hit the nail right on the head. Digital. It's no longer remote working. It's now digital working, and it's upon us. This is the new norm. Thank you very much for that. Thank you. Really appreciate. Our time is fast spent. I would like to quickly go around the panelists to give us their last word. If I may, please start with Mrs. Odegbami. Please, could you just give us one word, one last word before we hand over? Thank you.
All right, so thanks. Just to say that the pandemic is not yet over. I'm sure there's still a lot of bends and curves ahead. So
thank you.
Let's continue to be aware, to not be complacent, continue to build on what we have done, and continue to learn from within the country, outside of the country, and just keep our people safe generally. Thank you.
Thank you very much, Mrs. Odegbami. We've heard it. Do not be complacent. Let's keep learning. We have a lot to learn. Thank you. Mrs. Alofe, please.
Thank you. I want to end with saying thank you very much to our governments who really were faced with that dilemma of balancing the protection of lives and livelihoods. It's not easy governing people, not to mention 200 million of us, very, very stubborn and difficult and challenging individuals, but we thank our governments. And likewise, we thank the leaders of our different organizations who stood up to support employees, to support stakeholders, customers, partners, and just focus on keeping everyone safe. So going forward, that centricity of people, like I said when I started, of the employees as well, stakeholders, whoever they might be. Lafarge, therefore, like I mentioned, the stakeholders in their communities of operations, putting them first. Because when we take care of people, they will take care of our business. So that for me is very important. Thank you very much, everyone.
Thank you. Thank you, Mrs. Alufe. Taking care of people, of course, they keep the wheels of the organization turning, and the government are the greatest HR professionals. Thank you very much for that. Mrs. Amobi, please, your final
Thanks very
word.
much indeed. My final words really would say a very, very big thank you and well done to the Nigerian workforce, to our employees, to these people who have risen. Employees indeed have been at the center of business continuity management. I'd like to appreciate all employees, the entire workforce in corporate Nigeria. A very big thank you to you for taking responsibility. And I'd like to encourage that you more than ever before now. Important thing is that we survive. Important thing is that at the end of when we really get to post-COVID, we are all still around. So please continue to take individual responsibility, demonstrating these still the most important component in combating COVID-19, social behaviors. Ask yourself today, my personal social behaviors, COVID-19 compliant? Are you maintaining the social distance? Are you keeping yourself masked up when you go out? Are you limiting your interaction to large gatherings? I couldn't resist that temptation. Drive right social behaviors. We will make this history in a shorter, not longer term. Thank you very much, Business Day. Excellent program, excellent focus, and excellent community here today. Thank you.
Thank you, Mrs. Amobi. Well, she said it all, and she rounded it up perfectly. From my side, I would just like to say it is becoming more apparent that we understand our individual responsibilities, contributions, that we maintain relationships, we leverage on opportunities and platforms like this to gain experiences and share experiences as well, and collaborate as a community in order to be better prepared for the future. but it's if it's with the different waves of the COVID-19 or a new pandemic, we will be better prepared and better ready. A very, very big thank you to everyone, to our panelists and to everyone that joined. Thank you from me. And I would just like to hand over now to the organizers of the event. Thank you.
Thank you.
Thank you so much. Cheers. Bye.
Thank you. Thank you so much, Mrs. Biola Onyejeku, as well as all the wonderful panelists we had. It was a very insightful session we had. Next on the program will be the presentation by the CEO of Total Health Trust, Mr. Kieran Gooden. Mr. Kieran Gooden, here, you have the floor now.
Thank you. I appreciate it. I have a few slides that I will put up just to talk through, but I wanted to say up front, that discussion was really encouraging for me. Just listening to the work that's been done in the organizations, that you will see in my slides, which I promise you I concluded yesterday, there's some overlap. So that's really encouraging to see that we're of one mind around some of the things that we need to talk about. So let me just put this up. Awesome. All right, super. So I'm going to talk just quickly about the topic of our conference. So the surveying the workplace, and is it a trauma or is it a triumph? And I'll get back to that question right at the end of my presentation. I'm just going to skip through what I'll cover, but so very quickly, and none of this is new, but there are one or two things here that are interesting. So officially in Nigeria, 153,000 cases recorded. So that's the statistic that is shared by the NCDC and is on all of the websites. What is incredibly interesting is that 2 days ago, the NCDC issued the results of a seroprevalence survey. Basically what that means in non-doctor speak is a survey of COVID-19 antibodies in the population. And what their survey showed is that the infection rates in Lagos State and Enugu State was around 23%. And to be fair, they only surveyed 4 states, but it was very interesting to see that kind of number come through. So if you buy that, and you believe that it's, and certainly they seem to indicate that they believe that their survey was statistically significant, that means in Lagos State alone, we've had upwards of 4.5 million cases of COVID-19, as against the 54,000 that we've officially recorded. In addition, we have now also found a new variant in Nigeria. So this is in addition to all the other variants that have been found around the world. But at this point, very limited data around that particular variant that's got some fancy name with letters and numbers in it. The mortality rate remains uncertain. Are we counting it accurately? Are we recording everything we need to be? Are we recording everything that's related to COVID? We're unsure of all of that. What we do know is that the impact of COVID-19 is real, and that it is here, and that we shouldn't poo-poo it. And in that light, I would like to tie in with Mrs. Amobe immediately. Continued vigilance is absolutely vital. So just a little bit the Nigerian context, and I'm going to kind of lead into work and working. But the Nigerian context, as we know, Nigeria is a unique country. It has very specific concerns. I think sometimes what happens is that the data, the research, the advice from various bodies is very Eurocentric or Western, North and Western Hemisphere centric. So the US, Canada, kind of first world, they sort of issue advice around how things should be done. Now that works for them, but it may not necessarily and probably doesn't work in large parts of the world. So in Nigeria, we have to ask ourselves, how easy is it to work from home or work remotely? What is the impact on our staff, both on their well-being and financially? And then also, you know, just the attitude of people, so self-compliance of people, you know, and we keep saying it, and I think this is probably not the audience to say it to, but I think if any of us were to go out into our streets now, we would see very little mask wearing or social distancing. Certainly when I drive around the roads or I drive through the markets, it's almost as if there isn't a pandemic on the go. You might see the odd mask, but you see very little else that appears to have changed. This is a picture, and there's another one that I have later that I actually put up at this particular conference last year. And I thought when I was having a look that this would be actually worth putting up again. There were, before the pandemic, evolving global attitudes to the way that the work environment runs, the well-being and health in the work environment. And you can see, if you look at this picture, that it's more than just about physical well-being or physical health. And that you have to take into account a whole different range of things, and there's a whole model around which you would do that, at the core of which is the ethics and values of your organization. So just to loop back to those evolving global attitudes, and even pre-COVID-19, this stuff was not new. What has happened is we've seen acceleration. So there was, before the pandemic sort of landed on us, a shifting focus to prioritize well-being. The World Health Organization talks about these things, collaboration between employers and their employees. They talked about health and safety in the physical work environment pre-COVID, but you know, I've added digital to that now because it's the same principles apply. The psychosocial work environment, or just the culture of the organization, how the place smells when you walk in the door, just the touch and feel of it, which is sometimes so difficult to define. Then personal health resources from employers. And this is not just about at the workplace, as we've now all had to adapt. It's what is the employer doing, or what are organizations doing for their employees, wherever they happen to be. And community mindedness, I think that's also been coming probably even longer than some of these other things, but continues and has been reinforced as really important. Why does it matter? And again, this is the other picture that I actually showed last year at this conference. But the societal diseases, the diabetes and heart disease, these things have become more and more prevalent in all of our societies. And stress brings on a whole spectrum of different concerns or different impacts within the work environment. What's happened is all of this has kind of gone on to steroids. It's just been exacerbated massively because of the pandemic. And you've got isolation on the top of that. So now it's almost impossible to see what's happening to your people because they're not around you. And it's really hard to do that when you're connecting over a screen or attempting to connect over a screen, because people can hide. I see that with my children at school. They very happily will hide away from their teachers and not sort of let them see what's going on. I think we all know, and certainly if we were listening to our colleagues a few minutes ago, companies with healthy and happy employees have lower corporate healthcare costs, have more effective and productive employees, less absenteeism, less medical leave, higher rates of retention. It has a positive impact on the profitability of organizations. If employees are happy and healthy, the profitability of the company is going to be higher. The data says that, our common sense will tell us that. We all know this to be true. So what are some of the things that employers should think about? And this has sort of evolved over the last year, but we've had to adapt ourselves from crisis management to sustainability. So I think in the first few months, we were all managing a crisis We had a lot to do. We all kept ourselves really, really busy. Your crisis tends to focus the mind and razor sharp. So it was sort of almost easy to get going and to keep going for that first period. But once you settle into a rut, it becomes a lot harder to maintain that momentum. And that sustainability of the organization is a big challenge now, I think, for all of us. There isn't a straight or easy choice between lives and livelihoods. So we talked about that with the government now, but I think even for companies, that choice exists, and there's somewhere along the spectrum that you have to make a decision. In no organization is the risk zero. We've seen, I think, even in Nigeria, looking around, the spread of the disease inside companies themselves, that kind of community transmission inside companies is probably relatively low, but people are getting it outside. So there's a possibility that they can bring it in, but nevertheless, even if your people are getting sick not in your organization, that presents a risk to you. The loss of social capital. Social capital is what I've kind of called, we've talked about human capital and you've got financial capital and so on. Social capital is the culture of your organization. It's what binds your company together and makes it what it is. It's so you can identify yourself as a THT employee and know that you belong to that tribe. That's what social capital is. And I think you burn that by not being present with one another. And then we have to think about what the impact is on our customers. And are we able to manage, or do we just think that we can manage? And all of this, we have to balance belonging, well-being, and productivity. So what do employers do? And how do we go about it? And I think we've heard some incredible success stories already this morning. I think there are, and certainly we speak to a lot of companies. There are companies that are still struggling and struggling to work out what they need to do for the long term. And bizarrely, there are even organizations that are still struggling to work out what they should be doing to manage the disease or put in preventative measures. But some of the tips that we share, foster open communication and a transparent culture in your organization. The tone unquestionably comes from the top. That point about the chief executive really speaking to the people all the time is absolutely vital. It just sets the tone for everybody. They know where they stand. Protecting the culture and the social capital of your organization. And whether you do that remotely or whether we start to go back into the office, I personally am one of those people who doesn't think that the world has made a kind of 180-degree flip and is moving in a completely different direction permanently. I think there's huge value in having people together. And I think we will be back in an office probably to a greater degree than a lesser degree in the relatively near future. But whatever it is, you've got to protect the social capital of your organization and develop new skills to do your work, but also skills to manage your people. So supervisors need new skills as well. You can't do this, there's that saying that says, and it gets attributed to all sorts of people, that if you do the same thing over and over and expect a different result, that's the definition of insanity. Where we are now, we want the same result, but it means we have to do different things on a day-to-day basis. Then holistic wellness. So we've talked about that, but really the physical side, I think, has had focus in times past, but social, financial, emotional, that mental well-being has become absolutely vital and has really surfaced itself over the last year. I probably couldn't put it better, but than Mrs. Amobi, but the non-pharmaceutical interventions do work. We call them the 5 golden rules. I think everybody has a version of that, but they do work and they should be enforced. If we're encouraged to be for your people if they're not in the office, but enforced if they are in the office. Remote and flexible work. It's not new. It's just been incredibly accelerated, sort of at Mach 3 over the last year. And then at the sort of technology side, invest in technology. I don't think we can cope with the technology we had and just do it from elsewhere. We have to invest in new technology and ensure that our employees have the tools to work wherever they happen to be, whether that's in the office or not in the office, and we'll probably have people in both locations. Verdict, and my verdict, I think it depends. I think it depends on how you responded as an organization. I think it depends on how your country has responded. I think it depends on how your people have responded. I think some companies have got it incredibly right. They've done almost a fantastic job. But some people, I think it is still a trauma. And forums like this are really useful to help us all manage that. So thank you for listening to me. I appreciate it. Enjoy the rest of the conference. I'm looking forward to a really engaging time and discussion.
All right, thank you so much, Mr. Kieran Gooden. It was a very lovely presentation there. I'm sure everybody learned a thing or two. Now we're going next to the second panel for today with the topic, drilling down, trends in corporate spending on employee health and well-being. Drilling down, trends in corporate spending on employee health and well-being. The next panel is going to be moderated by Mrs. Adetutu Afolabi. She's the CEO, Wellness HMO Group. Mrs. Afolabi, please kindly take over.
Thank you for having me. Thank you, Fumilola. Thank you for having me. I want to say welcome to everyone to the second annual Business Day Workplace Health and Wellbeing Conference. It promises to be exciting, and I want our audience to also know that you're allowed to ask questions and give suggestions, especially when it comes to the health insurance business in Nigeria and how you want to be served. Don't forget to Don't forget to ask questions. I'll read out the quotes very soon. I'm Adetutu Afolabi. I'm the MD CEO of Wellness Healthcare Group. Wellness has emerged from being a community pharmacy practice business to health insurance business. And right now we're in the forefront in the advocacy for wellness. A lot of people now think about wellness. We're saying that wellness is beyond a lifestyle. Wellness is beyond just losing weight. Wellness is beyond just changing what you eat. It should be a lifestyle. It should be something you're deliberate about. It should be intentional. And we're also looking at what to do today from the questions and suggestions we'll be giving on how we can be more intentional as industry practitioners in the health insurance business on what can be done beyond the physical wellness, beyond access to care when people are sick, to what we can do on the mental and emotional wellness and well-being of the people. COVID-19 has been a disruptor. Everybody knows COVID-19 has been a disruptor. It has disrupted the economies of the world. It has disrupted the way we do things. It has disrupted the way we learn. A meeting like this would have been done in one fanciful conference hall where we all have the opportunity to meet ourselves and joke and talk and look at how we're bridging this distance through technology. And you know, the health industry sector has never gained so much attention as it has gained in the last few months. And when you look at it beyond the investment in the health industry sectors, we also know that there is a lot of conversation on deliberate living. There's a lot of conversation on the mental wellness of the people. There's a lot of conversation on the emotional wellness of the people. And I also believe that the health insurance people, the health insurance practitioners also should see this as a turning point for the health insurance industry by enabling insurance to demonstrate some higher purpose and value to the society. It should be beyond going to the hospital and getting care. We need to do something more. So with me today on the panel are veterans in the health insurance business in Nigeria with years of experience on how to ensure that people have quality healthcare. My first panelist is Mr. Kieran Gooden. You just listened to him. He's the CEO of Total Health Trust Limited. Kieran has a background in finance, and he keeps leveraging his experiences to give valuable and strategic input into making Total Health Trust and Healthcare company, especially in his 3 years in Nigeria. Welcome, Kieran, to the panel. My second panelist is Tope Adeni, is the CEO of Haxon Mansard Health Limited. Tope has over 16 years experience in information management, manufacturing, and financial services. Tope believes that the productivity and survival of every nation rises and falls on the wellness of the citizens. Welcome, Tope, to this panel.
Thank you.
My third panel is Aduratomi Kuti. Aduratomi, I love your name. Aduratomi Kuti is the head of products in Hydra HMO. She has spent the last 7 years in the health insurance sector, developing and evolving health underwriting models for both corporate and retail health care. Welcome, Aduratomi, to this platform.
Thank you very much.
Okay, without wasting so much time, I will start by asking my questions. COVID-19 has impacted on the world economy. I want to direct this first question to Tope. We know that the conversation around the health insurance business, around health, has been so much in the last 9 months or 10. We, of course, there's really no way we can take COVID-19 out of our world without paying attention to the drugs that has to be taken care of, has to be used, the vaccines and all the investment around health. And we also know that for a country like Nigeria, there's been an increase in the cost of care when you look at the foreign exchange. I want to ask 2 questions in a row. What has been the impact of COVID-19 and its related maladies on the HMO business in Nigeria? And also, when you look at the adoption rate of health insurance business in Nigeria, it's less than 5%. Has there been an increase in the conversion of non-consumers to consumers in the health insurance business in Nigeria? Thank you. The floor is open to you, Tope.
All right. Thank you very much, Mrs. Afolabi, and I'm pleased to actually answer some of these questions as it boils into the demand side of healthcare. The first question is about the impact of COVID-19 on health insurance. Like any other business and like any other industry, COVID-19 has affected health insurance business as well. But I'm going to talk about 2 dimensions of the impact of COVID-19. The first is that sounds a bit negative, not too palatable, is the fact that because the economic power of the consumer weakened during COVID-19, particularly during the lockdown, the GDP impact until we enter into recession again for the second time in the last 4 years. Now that actually led people not to be able to pay for their health insurance, and that's also reduced the growth of health insurance, particularly in the 2020 COVID-19 pandemic year. So that's actually suffered a bit. And also the impact of COVID-19 also led the health insurance companies, some because they were not actually, some may not be immediately prepared for the lockdown, so such a way that they had not been properly equipped with all the technology, technology devices that they require. So when you have not been fully automated, you suffer a gap in service delivery, and that can actually again cause more problems for the team. But overall, there are a lot of positive side of the COVID-19. The first positive side I can see is the fact that awareness increased about the need for proper and structured healthcare. So a lot of conversation began to come up everywhere to see the need for help, the need for us to take care of our health and well-being. Even government began to rise up. You will notice that in the last 1 year, we have had the House of Assembly pass on the health insurance bill, and the Senate has passed it. And recently, I think the House of Rep also passed it onto the presidency for assets. So all of this show the impact that the industry is likely going to also experience more growth. The other side of it that is positive, apart from awareness, apart from the fact that people are more aware of their healthcare, is the fact that the health insurance industry also was able to actually accelerate its technology drive. You will hear Kira was talking about the fact that it's not that we woke up onto seeing technology use in the system, only that we actually began to accelerate, because now we had no other choice than for us to be able to use all the technology provision for healthcare consumption. So for example, last year there was an increase in the use of telemedicine. AXA deployed telemedicine, for example, last year, and the telemedicine that had not been used up to 1,000 before literally became 10,000 within a few months, and 20,000 consumption within another few months, and people began to actually leverage on technology channel to be able to get their care done. So that's positive. That's helping us to be able to enter into the culture of actually utilizing the channels that will be more effective, that will be cost saving, that will enable the consumers to have more convenience. And of course, we can also reduce the need to continue to have sick care. Like you mentioned earlier on, the health is not just about curative, it's also largely about preventive, particularly in an environment that we have like this, where we cannot actually afford a huge cost from government expenditure point of view to be able to take care of the health of everybody. So we must be creative to be able to do a lot of preventive, a lot of ways of reducing cost of care. So health insurance actually been possibly affected in the fact that there's more adoption of technology channel, there's more adoption of other creative and innovative means for healthcare that people actually began to use from the beginning or from the middle of the pandemic particularly. And I think the second question around on COVID. Sorry, I can't hear you.
Adoption, around the second question is around adoption of non-users, of non-consumer of health insurance scheme.
Okay, so COVID has this, which is again the second positive side, like I said. So because of COVID, again, health awareness increased and people are making more inquiries. So if you Google now, compared to 2019 to 2020, you will see a lot of more inquiries about health insurance, about prepaid system, about how they can actually come on board. So inquiries are increased. Now adoption in terms of enrollment has also increased. And I was talking about the increase on two sides. First, on the government side, there are about 12 states right now that have adopted health insurance in Nigeria. And the total enrollment around the state-based health insurance alone is going towards 2 million. So that was totally different from this time 5 years ago, 4 years ago, where the adoption was just around 2 states and it was just crawling at about 50,000, 100,000. Now we have more people, who have adopted an insurance, even from the public space. Lagos State, there are several other states that have adopted, which is quite positive. Again, of course, the private sector also, those who buy private insurance has also grown, albeit slowly, because a lot of private sectors still use postpaid, out-of-pocket payment, but quite a number of them has also grown. Altogether, we have seen about 10 million insurance subscribers in Nigeria today, which is just about 5%. But that was actually a growth over the last 3 years, what I consider at about 10% year-on-year growth over the time. So we still have a long way to go, but I think adoption has increased steadily, and we think that we can actually have much more in the next couple of years as we face the public with the relevant solutions that will help them.
Thank you very much, Ope. Thank you for the fact that it's funny when you realize that telemedicine that people feel is not possible, especially when you when Nigerians say comments like Ojulorowa when they want to go to the hospital, as in you just want to see the doctor, you want to feel the doctor check you with the stethoscope. That's when you want to be sure that someone is listening to you. And now we have a lot of people going on the telemedicine platform to quickly speak with the doctor. Of course, some of them it's actually based on the fear of going to the hospital and contracting COVID-19 or anything, or the way to the hospital. And the fact that more people are making inquiries. You didn't tell us if the inquiries is turning to conversion, but we're hopeful that the inquiries are turning to conversion. Is that what you meant?
Okay, so some inquiries are turning to conversion. Certainly, there are always lead time to get this thing done. But actually, you see also the adoption is increasing, the inquiries are turning to conversions. And I think it's across, all of the practitioners in the health insurance, which is also a positive sign. Not quite significant yet, but it's a good step. And we hope to see more of this in the coming years.
Thank you, Tope. Thank you for Thank you for your answers. I want the audience to join this conversation. Please visit www.slido.com using the slide code #WHWC. We would like you to join the conversation. We would like you to suggest to us, because I'm going to be asking questions on what we need and how we can step in as health insurance practitioners when it comes to the emotional and mental wellness of the people. Also, my next question goes to Kieran. Well, I want us to look at, I want to ask questions around the sustainability of the health insurance business based on cost-benefit analysis and the fact that organizations that have laid off staffs or organizations are changing the benefits coverage of the people based on what the economy is saying. And also with the lots of people falling ill and all that, how sustainable is the health insurance business and the universal health coverage at affordable rate that is what is the dream for the scheme?
Thank you. I think health insurance, like every other industry, is having a difficult time of things. So I don't think it's unique to us that that times are hard, and we're having to make sure that we manage our way through that. I think maybe we've got some additional pressures, but my sense is that our situation is not fundamentally different to most other organizations in a difficult economy. So I think what we need to do is look at the fact that the economy is really, really struggling. The lockdowns have caused a huge economic impact, both domestically and the fact that the globe has been locked down. And that has caused this big stumble. And in particular for us here in Nigeria, the fact that the price of oil fell off a cliff has dried up a lot of the foreign exchange. And I think most organizations that have commitments outside of Nigeria, if not all of them, will know that it's incredibly difficult to get foreign exchange now, and the prices have continued to go up. So particularly just to come back to our business, I was talking just now when I presented about sustainability. So sustainability for people, but just sustainability for your organization. So if you have been managing your organization on the principle of sustainability for a period of time prior to COVID-19, you're far less likely to be impacted by the fact that there is a pandemic. So a lot of our principle in our organization is built on sustainability. So we build a sustainable model for everything. So what we want is repeatability in every single process, repeatability in our finances, repeatability in our products. So if it's something that can outlive the individual, it's a process that can simply be done over and over again. You've built yourself a sustainable model. And on your balance sheets, you need to make sure that you've got protection. If you were operating, I think it's true for every organization like this, but if you were operating right at the brink before COVID, the likelihood is COVID is probably going to have tipped you over the edge. If you were operating on the basis that you were looking to the long term, you were building something for the future, you had resilience and sustainability built into your plans, the likelihood is that you'll survive. And I think looking around the industry, I think there's a number of health insurers that are stable and that are able to continue to manage. There are probably going to be unfortunate casualties of the pandemic. There's no question. As an industry, though, there's no doubt in my mind that health insurance or the HMOs will absolutely survive. The beauty of the system is when we share risk, and that really is the principle on which we build insurance. So if we're all sharing risk, the more people that participate, the more sustainable the industry becomes. It's when people start wanting to, they know they've paid 1,000 naira for whatever, they've paid 1,000 naira, for example, for their health insurance this year, but they haven't been to the doctor. Now they expect to get a discount for next year. That's not the principle on which it works. because the person next to you paid the same 1,000 naira, but he had some major problem. So he had healthcare of 5,000 naira. Do we then increase his premium to 10,000 naira to cover the cost of that? The idea is that it's affordable for everybody. And I think if we can continue to speak to that message as an industry and continue to have more and more people participate in the industry, we will be able to maintain a sustainable industry. Costs are pressure. But again, the more people that participate in the industry, the better you can manage the costs through some level of economy of scale.
Thank you, Kieran. You were able to throw more light on the fact that with increased in awareness and adoption, the health industry and the health insurance industry in Nigeria is bound to survive. So the onus is left to all of us to ensure that there is increased awareness, having more people adopt it. And Tope also mentioned that we need to be creative in ensuring that we reduce cost. The cost of care has gone up now because most of the care is actually done through pharmaceutical care, and the cost of pharmaceutical care has gone up because of the exchange rate. So insurance companies that health insurance companies that might be in the audience is advised to be creative in getting this done. For our audience, please join our conversation. Visit www.slido.com. We want to listen to you. We want to be able to share your insight in ensuring that we deliver on our promises as health insurance organizations in Nigeria. My next question will go to Adura Tomi. Adura Tomi, as someone that develops products, we've come to realize that beyond the physical wellness, people actually need a lot of emotional and mental wellness. And the human resources capital in all organizations are looking at health insurance businesses, health insurance organizations who are their healthcare partners to see how they can leverage on this partnership to ensure that their people are not just physically well, but they're emotionally and mentally well. You will agree with me that sometimes the productivity at work is not just because the person looks well and looks pretty at work. It might actually be whatever the person is going through. What products are we looking at as health insurance organization to help human resources and capitals and the HRM team, the talent managers, to ensure that the people enjoy overall wellness?
Thank you very much for your question, Adetito. So we've had some conversations around mental health, just based off on the panel discussions that we've had so far, and that has been a very important and a major highlight of the focus at this point for most HMOs. And we have clients that have requested for some kind of support for their staff when due to the fact that people now work from home and they have to juggle all sorts of things at the same time. So trying to balance work life, trying to balance and have a separation between personal life and work, dealing with other difficulties like separation from family members or losses. So the shift has really been about mental health, trying to design products that will help have employee assistance programs. I think Mrs. Amobi mentioned that during her conversation, having employee assistance programs that help to allow some sort of confidentiality for enrollees when they go through any kind of mental stress, if they're trying to manage stress, the stress that comes from working from home. We've also had to shift some sort of focus into developing some kind of exercise, trying to keep people fit even while they're at home. So things like the gym access. So what we've done as an HMO is to try to improve our communication to the enrollees in terms of what they can do while they are home. So it's very easy to live a very sedimentary life. When you are at home, you just wake up, you go straight to your table, and you start walking, and the day just goes by, and you find that you didn't even do any exercise, you didn't step out of your house, you didn't get any sun for that day, and things like that. So we try to encourage some form of exercises. We've also tried to see there are things about nutrition, things that people really take for granted just because the focus has been on COVID for this period. But are people actually eating well? Are they eating right, even while they're home? Are they being conscious about what they ingest? Are they being conscious about the things that they take in? So nutrition has also been a very important highlight. And like Mr. Denny also mentioned, telemedicine has been a very important focus as well for health insurance. We've had to encourage people to use those platforms in the instance where what you're going to the hospital for might not be considered as emergency or not considered as very critical, if you can actually hold off the consultation. So telemedicine has also been a product that we've tried to push, and we've tried to encourage more usage on.
Okay, thank you, Adratomi. Thank you, Adratomi. To our audience, please join this conversation. Visit www.slido.com using the Slido code #WHWC. Adratomi, I'm going to ask you a question about all this development. What has been the adoption rate in telemedicine? I know that during lockdown, a lot of people actually use the telemedicine access, because of course there is you have problems when moving around, and so a lot of people make use of the telemedicine platform. What has been the adoption of the EAP that you do and all that, as the human resources department or the human resources capital of organizations that you serve actually leverage on these products, and has it been fully adopted by the clients that you relate with?
Okay, so at the initial start of the lockdown, we tried to encourage people to use those platforms. What we did was, initially, before the lockdown, we already tried to introduce telemedicine. So it was only like a bit of an advantage that we already had that process going. So it was easy for us to tell people that, oh, your plan already covers some form of telemedicine, so please try to adopt this. When the lockdown started initially, you still have people that really want to still go to the hospital, but there was a lot of engagement around which hospital can I go to? Do they have a COVID case at this point? Is the hospital closed down? And hospitals also engaged us in trying to get some form of telemedicine going on their own end as well. So the adoption initially at the first phase of the lockdown, the first and the second phase was quite high, because people were scared to go to the hospital at that point, because of the way everything has played out now. People are still adopting the telemedicine platforms. People are still calling in to speak to the doctor, and it's easier because you don't have to physically go to the hospital for the consultation. The telemedicine platform, the telemedicine doctor is also able to direct you and send you to a lab if all you need to do is just run some tests, or send it to the pharmacy if you just need to pick up some drugs based on their prescription. So that has encouraged people to not go into the hospital as frequently if it's something that they consider minor. So it's only if the telemedicine doctor says, oh, you need to have a physical consultation, or you need to see a specialist, then that when people actually just visit as well. So the adoption has been improving. It's improved the first phase, but second phase is kind of going down because people can now go to the hospitals. But it's a work in progress. Like you said, adoption. Your phrase about the Ojulorowa is very important here, because people still want to physically see a doctor in Nigeria now. Yeah.
Okay. I don't think the problem is just Nigeria. I think it's because sometimes we're social beings. You'll be surprised that people go to the hospital to gist with doctors as well. And so when you're telling them to do telemedicine, it's like there's some gist that I couldn't gist, and using telemedicine platform. I think those are some of the reasons why people just prefer to go in. And for some people, I know for like some older women, that's when they feel they could have some intellectual interactions. You know, when you sit down in front of someone that is well learned, you have intellectual interactions. And so that's why some older people visit the hospital. I know a woman that visits an ophthalmologist every two weeks. And when I asked her, she said, I just love to gist with her. And that's why I come. So for that kind of a woman, it might be difficult to make her. So we talked about employee assistance program. What has been that adoption? Because employee assisted program is meant to actually help people with their emotional and mental needs. What has been the adoption? Adura told me, what has been adoption on that?
Okay, so for the employee assistance program, what we've tried to do, because the need for confidentiality is very important for the HR of the organization to assure their staff of the level of trust that they can give in terms of what they talk about with the psychologists. Is it confidential? Will they have to come back and refer to the HR? Does it affect their work in any way? So the adoption for it is also growing. We've been able to incorporate it into our telemedicine platform in such a way that the staff doesn't necessarily have to route it through the HR because he wants to participate. He can just call directly to speak to a psychologist, and then we'll have some sort of follow-up on that instance. So the adoption for that as well is growing. There are people that still don't want to physically go to see a doctor. So that the fact that you can now do it virtually and you don't have to book an appointment at any point, it's made the adoption for it to also increase on that end.
Okay, thank you, Adura Tomi. Thank you. The HRM Capitals, the HRM Capital Talent Management and people in charge of human resources of organizations needs to encourage health insurance organizations with the products that they have introduced in terms of telemedicine and employee assistance programs. These products have been designed to also take care of the needs of the people, and just because we know that an average person would like to see people physically does not mean that people shouldn't be able to use those channels, especially when it requires them to open up to people. I know a lot of men don't like to open up to people, but we don't want our men dying in silence as well. So we want them to make use of this channel so that they can be well. I want to direct this next question to Tope. As practitioners in the data year on year, and you see, the organizers said I should ask who this data don't help sell. Who this data fee help? What can we do about this data to ensure that the universal health coverage, which is the main reason why the scheme was initiated, how can we use this data to help the achievement of this of the success of the scheme? What can be done with this data? How can we collaborate, aggregate, and build something substantial from it?
All right, thank you very much. I think it's a very important point to understand the need for data in healthcare management. All around healthcare system that work all over the world, the first principle is the fact that we must have good data. Most decisions around healthcare systems are based on data. Data to plan, data to intervene, data to collect data for all sorts of strategic initiatives that you have to execute on healthcare management. So some of the data gathered through health insurance platform include disease burden, geography of the patient, incident and the incident factors. We also have the drugs and the drugs efficacy. You have the diagnostics, You have a lot of the parameters around the gender, the demography, the age group. So you have a whole gamut of data based on the experience of the health insurance and the client. And of course, each of these data is stored confidentially and stored securely using the NDPR protocol and abiding by all the regulatory laws that govern data management. So what is the use of this data? First and foremost, the data is actually very helpful to be able to manage diseases as they also transit from one particular state to the other. So we began to realize that more and more people are beginning to have chronic diseases much more than before. So before, everybody thinks that it's just around malaria, it's just all around communicable diseases. But data began to show us that we're moving from, for example, we've seen incident rates of chronic diseases, that is non-communicable diseases, from 4% to about 10%. What it means is that more people are having hypertension, more people are having diabetes, more people are having diseases that are not cured through acute interventions. And that means that health insurance, health system policy formulators, as well as providers begin to look at where to actually begin to situate intervention programs in terms of managing those upcoming diseases, the prevalence of those diseases, and of course, prevention as well. So it helps to direct education, it helps to direct awareness, it helps to direct where do we put our focus, because we are having more and more incidents of non-communicable diseases. So that's the first one. It helps policymakers to formulate strategy. It also helps the healthcare providers to be able to know where to focus. And for us at Health Insurance, it helps us to be able to have appropriate products. So that's what makes us to continue to create new products. Now, for example, before now, employee assistance program used to just be mere like something nice to have up until 2017. By 2018, we saw a very important need to actually make EAP available to clients. And of course, the awareness went above the roof, hit the rooftop by the time COVID came in, because mental health became a major issue when people started working from home, when people started, doing remote working and all of that. So the data we collected over a period of time enabled us to be able to come up with the right product, with the right intervention, with the right awareness, with the right platform that will be able to attend to the needs of the people in their various disease bodies. So planning is very important. It helps health insurance to plan apart from aside the health policy formulator. It also helps us to be able to have the right intervention in the market. It also enables us to be able to see efficacy of drugs. So sometimes you see that over time, certain diseases develop resistance to certain pathogen, that is the organism causing diseases, they actually develop certain resistance to drugs. So the data we collect over a period of time enable us to be able to see those resistant, disease carrier, and be able to now see what to do, which becomes an information to the manufacturer, to the drug manufacturer, as well as to those who actually do the treatment protocol for certain diseases. So all of these data, they are useful for both government, for private sector, and more importantly, they're very useful for the client. So each of the enrollee begins to also understand, as he takes ownership of his healthcare or healthcare, the importance of those information that we share confidentially with the enrollee or with the member that is insured on the platform. So altogether, each member is equipped with more information to guide on decision making and to improve the wellness or his lifestyle in order for him to be able to take better decisions as regards to well-being. So it helps the enrollee, it helps the customer, the consumer, it helps the government that formulates policy, it helps the health insurance and healthcare providers to be able to know where to actually situate their interventions per unit time.
Thank you very much, Chope. Thank you very much. So this is an understanding that the data we gather has also been one of the reasons why we have different products being offered by the health insurance business year on year. And it has also been able to make us realize that, before now, people in their 40s are the people that begin to have hypertension and diabetes. And now people in their 30s are beginning to come down with hypertension and diabetes. And maybe this will also should help us with our drive on intentional living, especially when some of this chronic illnesses, apart from hereditary, as a result of the way our lifestyle has been. I also want to ask a question. Individually, I know that organizations will make use of this data, because that is why you are in business. You're going to make use of this data. Is there any collaborative efforts when we look at the larger platform? I mean, the regulators and the government now make use of this data in the formulation of what is required for the scheme.
All right. For organizations, yes, they make use of this data because that's what guides their health plans, health wellness, health week, and a lot of information on awareness. So the organization, private organization particularly, they make use of it. On the government side, government also makes use of this data, howbeit in a limited way, because government is still deploying a lot of technology to be able to aggregate the data and make more insight out of it. For example, NHIS has commissioned a very large deployment of health information system that will be able to collate a lot of the data pan-Nigeria, so that they can it will improve, the use of this information, because hitherto they have actually been collating it manually, and that is slow and that takes a lot of time to be able to get that done. So as government improves on technology, as government improves on data management system, they'll be able to actually take decisions quite quicker. They'll be able to see the trend. They'll be able to see the various geography for them to do, to actually have some certain interventions. But I must give kudos to Lagos State, because Lagos State seems to have advanced in a certain way, because they have more information, a bit more timely than maybe other states of the Federation in terms of the healthcare. So as we exchange data with various government institutions, they are able to process it and be able to use it for certain decisions that will enable a better healthcare for citizens. So I think the government is working towards making things better through automation, making things better through collaboration. So by law and guidelines, we are expected to send certain information on a periodic basis to the government, various government bodies, which we do, and that helps them to be able to take more decisions. So this cuts across both public sector systems as well as the private sector systems. Even though public sector system already has some form of route in which they collect their data, but everything still needs to be more automated in order for the central regulating body to take better decisions.
Okay, thank you, Chokwe. So until we are able to drive this better but through technology on a larger scale, maybe we'll be able to have more informed decision based on the data all the health insurance organizations are sending to the government. Thank you very much. We still want our audience to join this conversation. Kindly visit www.slido.com using the Slido code #WHWC. Thank you very much. My next question will go to Kiran. I know that the economy has had impact on an average organization in Nigeria. Apart from the fact that some organizations had to lay off staff, COVID-19 was kind of a recalibration. People now realize that maybe the number of staff that you have couldn't be justified based on what they do, and people were laid off. What have you been able to manage your clients that are now defaulting on premium? How have you been able to manage your clients that tell you that, oh, we're doing family plan for people now, we want to do just single plans? How have you been able to manage your clients, looking at what Tope said about the fact that, or we concluded that people are may now be having, before now somebody could tell you, oh, I just want a plan to manage malaria, typhoid, and all that. How have you been able to manage your clients that says that, okay, I know this plan is robust, but this is what I want, something just to manage malaria and typhoid and all that. How have you been able to sell that idea to them that malaria and typhoid is not just enough, in spite of the fact that these people are going through great economic turmoil?
Yeah, so I think we've actually probably been quite, maybe pleasantly surprised by the reaction of our clients over the last year. And I think, looking back, that has a lot to do with the nature of what we do. So in the middle of a pandemic, the service or the product that becomes incredibly valuable is health insurance, well, healthcare, but health insurance to help fund that. So the value placed on what we do, I think, has actually increased over the last year. People have become more interested in some of the services that we offer and the way that we do things. We have seen in isolated cases in certain industries that they've been almost forced to reduce their staff complement. So we have seen some of our clients who in particularly sensitive industries who have reduced their workforce and have had to cut their costs. We have had very limited numbers of people actually not being able to or being unwilling to pay the premiums for their health insurance, or kind of pushing to downgrade their health insurance. I think people at this time want to make sure that they're getting the cover that they would actually want. So if you had a plan and you downgrade it and now you're not covered for a whole bunch of things, potentially including COVID, the value disappears, and the relationship between the organization and the employee, I think it almost breaks, because the employees will see that as a sort of lack of faith or a lack of trust. Our response to discussions with clients, or with either with existing clients or with new clients, is really what we have to do. And our challenge as health insurers is to demonstrate why it is that we add value to their members, to their employees, to them as clients. What value do we bring to the table? And if you're unable to demonstrate the value that you bring, and why it's important to have health insurance, then it's difficult for you to either retain clients or to get new clients. But I think if you get it right to demonstrate the value and to show people why it's important that they should have health insurance, to cover these unforeseen circumstances, to cover these big costs, then you have a very different conversation with people. They're more willing to engage you on the cost of the premium. They're more willing to engage you on the value that the product brings. They're more willing to engage you on the level of benefit that they want covered. But ultimately, what health insurance is not really there to cover things like malaria and typhoid, to be honest. If you have a product that only covers malaria and typhoid, the problem with that in Nigeria is that you guarantee that you're not going to make any money, because there's just such a big prevalence of these diseases. Everybody gets them at some point, and some people get them almost regular as clockwork once a year. So you almost know that you're going to have a lot of claims. People will go to the doctor for these things. What you have to do is balance that up with the items that are likely to come up less frequently. Now, health insurance, I guess in our mind, health insurance is there to take care of the day-to-day, but it's really there to prevent the bankruptcy situation. So it's really there, and this is this point of pooling of risk that I was talking about earlier. It's really there so that if something really, really nasty happens and you have to incur a bill, and we've seen bills for cancer treatment or for really serious disease, for serious road accidents, that if just to put it into dollar terms so that it's more stable, but you could be spending $50, $60, $100,000 to treat one person for one particular thing. Now, there's no way that any of us, maybe there are a few people on this call who are very blessed, but I would think the vast majority of us do not have $100,000 just in our bank accounts, just in case there's a rainy day. And that's really where the health insurer plays a big part, because we can share that across a large number of people. So the answer, I think, to the malaria typhoid is that's not a product we would ever sell to anyone. So unfortunately, it's not available. But we try and explain the value of what it is that we do. We have obviously had to have a lot of discussions with a lot of our clients around being accommodating. I think any business in this day and age that thinks that they can just dictate terms and operates in the same way as they operated pre-pandemic is very, very naive and likely to be struggling, because they're going to be going out of business. So we've certainly had to engage customers on the way that they're paying, perhaps what their premium is, the level of costs that are going up. We've had to have very long conversations. We have one or two clients in the aviation industry, and as we know, aviation just closed for 6 months. There was no work, there was no revenue, there was just nothing happening. And we have some customers in the was to zero in one day. No organization has contingency plans for these things. So we had to have a long conversation with these clients. And I think what that does is it builds loyalty, because those customers, what we've seen is those customers have, the industry has opened up again. They have recovered, and we're walking a path together. So it's a balancing act. We have to be sustainable, and our customers have to be sustainable. If our customers are not sustainable because of our actions, we're not going to have any customers in the future, and then we're not sustainable. So there is an important balance, but I think the key is probably making sure that you demonstrate the value of your product.
Thank you very much, Kieran. And I must say that it's laudable to see that most organizations actually paid attention to the healthcare needs of the people, even at these trying times. You mentioned that some have had to increase what a package is like to accommodate some contingencies and emergencies, COVID-19 as posthumous. And in spite of the difficulty in the economy, a lot of the organizations have made it a point of duty to ensure that the health insurance, the health coverage of the people are well taken care of. So we want to say thank you to all organizations that ensure that the healthcare needs of the people are well taken care of, irrespective. And of course, I know sometimes medical doctors wonder why they have to treat malaria so much these days, or so much in Nigeria, especially when malaria is preventable. It's kind of funny that 70% of the people that present in the hospitals most times have malaria. I think for everybody in this audience, we need to kick malaria out of Nigeria. Doctors want to focus on bigger things. We need to kick malaria out of Nigeria. We need to learn to keep mosquitoes out of our homes and our surroundings so that we are healthier. My next question, our audience kindly join this conversation. We want you to visit www.slido.com using the slide code hashtag WHWC. My next question will go to Adura Tomi. Adura Tomi, for actuaries, how has COVID-19 muddled the waters by making it more difficult to project medical costs and utilization levels, mix and intensity of services, and the composition of risk pools? In Nigeria, most of the cost that we have, the cost of pharmaceutical care has gone up. not just because as a panic to COVID-19, this is not like ivermectin going from 14,000 to 50,000 all of a sudden because people are buying it because of panic buying. But we're looking at the real cost of care. How has this affected your actuaries' activities?
Okay, thank you for the question. So there were a couple of data insights that we've gathered so far, right from the start of this pandemic. We've seen that there are other things that people are still going to the hospital for, which hasn't really slowed down. So people are still going to the hospital. People still need to get surgeries done. People still need to there are still deliveries that need to happen. Maternity is still very important. So things like that haven't really slowed down because of the pandemic. That there's no significant reduction in elective treatments. People still want to go to get their glasses. People still want to do their dental appointments and all that. So factoring in all those things into the actuarial analysis that's been done, we had to also consider the fact that, like the Lagos State governor said, there's been a surge in malaria treats malaria cases like COVID unless otherwise stated. But we still have to pay for those for those treatments because it's very hard to distinguish between that. So indirectly, there's still some ripple effect of the COVID cases on the rise. Some people don't believe they have COVID, and it's just malaria that they are treating. So they will not accept the fact that you don't want to cover for things like that. So there's still increased utilization across board, despite the fact that people are still wary to go to the hospitals. People still want to get their health checks done, especially in this time when everybody is now more health conscious about making sure that you are in top shape since you're always at home. So all those things have fed into the actuarial analysis that we have to do. The fact that people also still go to, so most workers we've seen now have more time to go to the hospital during the week, as opposed to having that surge during the weekend that you just say, well, I'll push my hospital visit to Saturday or Sunday. But now people go every single day, because they can just quickly pop in and come back and continue working at home. So it hasn't really changed anything per se. You still have to continue pricing the same way and try to factor in the price changes, the utilization increases. So clients will be treated on a case-by-case basis. Some clients might not have that much utilization, maybe going by the fact that they work from home. There are clients that are still front-facing. So things like that needs to also be considered when dealing with clients on a case-by-case basis. But overall,
okay, so what you're saying is that there's a level of certainty that is increased utilization. People are still going to the hospital, or people are even going more, yes, because they have more time. Because they have more time, yes, they don't have to be at work. They are working from home, so they could still pop in, and the utilization rate is going higher. I know there is a surge in yes, in optical visits right now, because a lot of us are on the screen 24/7 now. People are studying, yes, studying exactly, on the screen. People are working on the screen. People are doing a lot of so what's the impact? What's the impact on the sustainability of the health insurance business?
So for, like Mr. Gordon said, we've had to treat clients on a case-by-case basis. We've had clients come back to say, oh, because you have a restricted budget to be able to provide care, we don't want to shut anybody out. We still want to provide the same level of care to our employees. We've had to make modifications in their benefits, trying to prioritize which benefits are more important compared to others, trying to just find some kind of balance in such a way that nobody loses out ultimately. So yes, there's that impact on prices. Prices are going up. Like you said, the pharmaceutical costs are rising. You have the hospitals asking for increases in tariffs because inflation has gone up and all those things. So that has to be factored in, but we have to treat it on a case-by-case basis and try to put the client in our shoes, because we also are feeling the pinch. We are also an organization, first and foremost. So we have to always be sensitive to the needs of the client and try to fine-tune it based on their budget.
Okay, thank you, Aduratomi. Their listeners, their audience, don't forget to visit www.slido.com using the Slido code, hashtag WHWC. Thank you, Aduratomi. What she has said in a nutshell is the fact that we will not rest on our hearts. We'll continue to look at how to ensure that people are well taken care of, and we'll handle it case by case. So every organization will be handled differently. There's not going to be a blanket used to handle the needs of an organization. Tope, can you please help us with some of the reasons, some of the issues that are driving change in HMO providers by organizations? What are some of the reasons and the issues that are driving this change?
All right, maybe I should respond to that by saying that what's first and foremost leads to change, and change is actually coming from the fact that customer needs are changing, the environment is changing, so the entire macroeconomic as well as micro are changing. And so all of these affect the firm's ability to be able to respond. So some of the practical things that are causing changes in the way health insurance respond to the various pillars in the society include the disease transition that I spoke about the other time, that more and more we're having chronic diseases, we're having mental health issues, we're having economic issues as well. And that is causing health insurance to constantly think of how to plan an optimal quality without unnecessarily increasing the cost. So we have the economic issues like inflationary. Today, inflation is about 16%. Medical inflation also follows at about 12 to 14%. So in the basket of inflation, medical is very key after agriculture. And that is causing a lot of imbalance in the healthcare delivery system. So this is making health insurance to think back constantly to create solutions that be able to meet the needs of the people, so that we're not going to have drop in the structured system of the healthcare. Because if we are not careful, people will move in from prepaid system onto out of pocket, where they begin to patronize again, and upward structural system that are not proper. So the changes in the economic is causing health insurance to actually innovate more to respond properly. The change in people's lifestyle as well. The sudden transition we are seeing, or the gradual transition we are seeing from mere communicable diseases to non-communicable diseases, and things that are also new. For example, now we are having to think of how do we prepare for the next pandemic? How do we prepare for the next challenging, catastrophic event that can actually affect the entire community? Today, health insurance is not regular at covering pandemic and the epidemics of that type, except you're on global plan or some specialized plan. But then it is now a necessity for health insurance to think about giving people cover when it matters the most. So for instance, now, because of this such VUCA word, volatile, ambiguous, complex and unpredictable, we have also a need for us to respond in the same way. At AXA, we began to see what do we need to do. We started by having COVID support system for the clients so that we can actually manage their treatments, phases from early diagnosis onto the time if there's anyone that require isolation, partnering with both public and private facilities to be able to do that one. But the next thing is that how do we even ensure that vaccination is done? How do we now again prepare for the next pandemic that may happen, such a way that people are not left stranded when something that is not foreseen is done? So I summarize by saying what brings those responses are the changes that happen in the economy, changes that happen in customers' lifestyle, changes that happen also in the environment. Because again, if you have environment that is not very, very clean and hygienic, it continues to put burden of new, discovery of health challenges on the people, and consequently on health insurance companies. So overall, I think the response is always based on what is happening in the customer's lifestyle, what is happening in the society, what is happening in the economy, and what we're able to predict as well, as we also put an insight engine to see what is likely going to happen as it also happens in other parts of the world.
Thank you very much, Ope. Thank you very much. I think you've given us your rounding up message. Madra Tomi, can you give us in 30 seconds what would you like to tell the audience, especially the human resources audience that are here with us?
Thank you very much for the opportunity to speak here, and I think it's encouraging to see that the conversations are already going on around improving the mental health of staff. So it's just to keep encouraging the HR to always engage. We're always looking for solutions to better improve employee productivity. So if you have any peculiar or specific requests, it can always be incorporated, and we're always looking forward to improving the service. Thank you.
Okay, thank you. Kieran.
Thank you. I think maybe two messages to everyone, but I think to business leaders in particular: stay the course, hang in there. We've still got a path to walk on with the pandemic and the economy after that. So let's stay resilient. And I think for people that I guess are talking to their health insurer, talk to us. I think it doesn't help to make assumptions. Or to not understand things. I think it's important that we talk to each other. So the more we talk, I found the more that we communicate, and the more we exchange ideas, and the more we exchange views, the better things become for everybody.
Thank you very much. I want to say thank you to the organizer of this program. From all the panelists and myself, it's obvious that the health insurance organizations in Nigeria are willing, and they are open to collaborative efforts with the human resources capital of organizations, and also the willingness for all the products, the telemedicine, the employee assisted program, which goes a long way to improve the overall emotional wellness and the mental wellness of the people, are adopted and embraced and communicated as much as we can to our staff members or to our members. The health insurance organizations in Nigeria are willing to get this done, as registered by everyone on this panel, including Wellness HMO. We want to thank you for this opportunity. And just like I said, that this COVID-19 is a turning point for every health insurance business in Nigeria. And we hope that this will enable us to demonstrate our higher purpose and value to the society. Thank you, Business Day. Thank you for having us. Thank you for the second Business Day Workplace Health and Wellbeing Conference. For everyone that's listened, thank you for coming. Thank you for coming on board. We hope to see you next year. I want you to wait. There's a last session. Just like Nigerian jollof rice, the bottom part is always very sweet. So wait to make sure that you take part in the last part. Thank you very much.
Okay, thank you so much, Mrs. Adetutu. Okay. Thank you so much, Mrs. Adetutu Afolabi, as well as all the participants in this last panel. It was very lovely. We enjoyed the conversation. So we'll move straight up to the third panel for today with the topic, Plugged Out: How Remote Work is Impacting Mental Health and Productivity in the Age of Always On. This panel is going to be anchored by Mrs. Lola Esson. She is the Director of People Advisory Services, Ernst & Young, West Africa. So Mrs. Lola Esson, you have the room.
Good afternoon, everyone. And such a huge pleasure. Thanks to Business Day for the opportunity to be able to anchor conversations this afternoon. I guess you would, in terms of the panel lined up for this conversation, I guess this panel really promises you an exciting time. We've got experts lined up that will be giving us perspectives from different aspects of the topic. So let me just straight away go into it in terms of introducing the esteemed panelists for this afternoon. So I have Dr. Nita, beg your pardon, who would be he's an occupational health expert. He will be joining the panel to, of course, contribute to the issue plugged out, how remote work is impacting mental health and productivity in the age of always on. That will be followed closely by Emma Clark, who is the founder of Capacity Matters and Capacity Miners and Learn. And of course, my Oga, as the president of CIPM, so I have to really behave myself today. My membership is at stake. I've got Mr. Wale Adediran, who is the Group Human Resources Director of Flour Mills Nigeria. We can't clap, but I promise you that listening to these experts, because I spent some time to read their profiles and what they're about, we definitely are looking forward to an exciting 50 minutes. But we do plan to have the audience participate fully, by the way. So please make sure you go to www.slido.com and with the hashtag WHWC to contribute. Make sure you ask questions, like I mentioned, as you will learn from the background to be showcased on this panel. There's a lot to be learned. So this is your chance to ask all the questions. So, I welcome again at the esteemed panelists. So I really want to dive into it straight up. I'm looking back 12 months now, and I remember just how the world has changed. I was just saying on a meeting today with my colleagues that I haven't seen my desk since January last year. So I was wondering what would have happened to the supplies and all. So as we know, before last year, 9 to 5 was the trend. Our letters had you would work from 9 to 5 or 8 to 5 as it were, 1 hour for lunch break. We had policies speaking to dress code. But today, the term 9 to 5 is almost is almost alien to our consciousness. Once upon a time, people didn't trust that people could actually work from home. Looking back, I've had my busiest phase in terms of productivity, in terms of outcomes at work, working from home. And everything has sort of situated at one point. So of course, we're all logging in, and that's probably also the bad part. Everything now means you're always there. People schedule meetings now and probably not checking if you're available. Your colleagues who are in other parts of the world, because it's morning for them, they hook you up, you have to join. So we're constantly plugged in. But of course, as we all know, when there's too much of everything, there is potentially a downside. So I really want to hear from the esteemed panelists, and I'll just cue you into how the comments are. So I've shared my own perspective for looking back 12 months, how I could not have imagined that I would have my busiest cycle from being at home. I would suddenly not have worn a suit in over a year. I haven't seen my desk in over a year, all of those. So, what have you learned these past 12 months about work and productivity? So I'd like to start, ladies first, with Emma.
Thank you very much, Lola. It's wonderful to be here. And thank you to the team at Business Day for putting this wonderful conference together. It's really been quite impactful. I've learned a lot from listening to the various speakers, and I'm sure that we're going to have an incredibly amazing time during this session. What have I learned over the last 12 months? Well, it's as you said, work will continue no matter what happens. And productivity doesn't necessarily depend on working within a physical environment. But I've also learned that productivity comes with a cost, and I'm sure that we're going to discuss some of that cost during this session. I've also learned that it is very important, I put it this way, organizational and individual resilience is very, very important. So organizations have to be resilient. You heard what Mrs. Amobi said earlier on. There's got to be that emphasis on getting people to understand what language is all about, upgrading our skills in that area. And then at the organizations also have to, I'm sure that, that's why, for instance, this conference has been called, there's a move from concentrating just on profits and driving people to really understanding what it is that makes people tick. And then at the individual level, we also have to be resilient. We've got to upgrade our skills. We've got to constantly look at, improving ourselves. I mean, I'll give you an instance. I had a project the other day, and 1 minute before the project was supposed to go live, I had a consultant who pulled out because they got on, found out, and my goodness, this is not something that we're going to be doing in the physical space. This is something that we're now going to be doing in the digital space. And I think they had a burnout, or they panicked, or something happened. But 1 minute before that project was supposed to go live, I was called and I was told, I can't do this. And we had to put somebody on. And that showed me that expertise doesn't count anymore alone. It's expertise together with upgrading your skills. Because what has happened now is that when we're thinking of doing similar projects, we're not thinking of that expert, we're thinking of the other expert who has the capacity to be able to come on and do the work. And then lastly, we've got to look after ourselves. Because Lola, you're talking about productivity going up, everything is a lot better since you started working at home, but there is a downside to working from home, and burnout rates are on the increase, stress levels are on the increase. And that's another thing that I've learned, that we've got to look for a way to manage this whole thing of working from home or doing remote work or whatever it is that, however it is that we're doing the work now. So that's basically what it is.
Thanks, Emma. So, I mean, I think you'd summarize that quickly, that for you, it's about resilience on all levels. So individual, personal, and then even the organization. It's a period of learning and unlearning. I particularly like the comments around expertise. I like to say that one thing I've learned is the fact that competence could sometimes be rated in terms of surviving these times, because the mindset shift has become sort of a stronger leverage when it comes to handling the realities that this period throws at us. Thank you so much. So, Mr. Dediro, what have you learned looking back these 12 months about work and productivity? And in your own case, you are managing a conglomerate. So you've obviously had to take your people through very interesting times.
Thank you, Lola. Good afternoon. And thanks, I got your beautiful email. Thanks for bailing me out as usual. So let me highlight 4 things out of the so many things that I have learned in the last 12 months going through this experience. The first thing is nothing is impossible. I think we've limited the possibilities so much before the pandemic. And with the pandemic, we were proven wrong. We were proven wrong that in our belief that we didn't have the infrastructure to support working from home or virtual work. We were proven wrong that people could not be productive by working remotely and not under our physical supervision. So first thing for me was nothing is impossible. Second thing for me was truly people are the most important asset of every business. It's not as if I didn't believe this before the pandemic, but sometimes you struggle to convince your colleagues on the business leadership team about that mantra. For some of them, it's just a mantra, because when you bring the topic of discussing people and their future, they tend to reserve the last available slot for you. But now, almost all the conversations we've had, strategic or tactical, have been around people. We have daily crisis call to check in on people and to know how well they are doing. So, second thing I have learned in a new way is that truly it's not a mantra that people are the most important asset of businesses. The fourth thing for me is productivity is not driven by physical presence. I think we've been lazy in defining the key performance indices in the past. And that is why we look at productivity by attendance and hours available. So we look at the 9 to 5 syndrome. But now, from the experience we've had in the last 12, 13 months, we can boldly say that productivity is driven by other factors than the physical presence to supervise. The last point, but not the least for me, is the role of managing people belongs to the line. We cannot afford this centralized command and control approach to managing people. Human beings are individuals. Their challenges are individual and personalized, and there's a need for them to be so managed. The topic for this panel is looking at switching off. Honestly, what I have learned is there is no switching off. We just have to make sure that the 24 hours is interesting and healthy for the employee to drive the priorities of personal life and the priorities of the business at the same time. They can work together and be fun and lead to healthy living. That is my hypothesis. That's what I have learned in the last 12 months. Thank you.
Thank you so much. And I agree with you. You know, so the concept of work-life balance for me is definitely work-life integration, because it suggests that one is giving room for the other. But if everything is happening in the same space, I tell people there are times when I've had meetings and I'm actually in the kitchen, just like everyone knows they can't open a cupboard or put on a blender or something, because that's the reality. Everything is there and we're all working. But from the point of view of whether or not that is really beneficial, I mean, I'd like to hear from Dr. Nita, because you obviously are sort of dealing with the outcomes of some of these are nutrients. So what have you learned this past 12 months? And then I'll just want you to stay on to also just address my first question. So Dr. Nita, what have you learned over this 12 months in terms of work and then productivity?
Well, the first thing, Ola, thank you very much for having me on this program, and thanks to Business Day as well. The first thing is that I don't have to buy one more suit. Not at all. Thank you for also organizing this program, because I've had to wear it. I've not worn this suit. The first time I'm wearing it only for 2 years. So the first thing is that at the end of the day, there's only very, very few things we really need. Ola, can you hear me, Ola? Can you hear me?
There's a bit of static, but it's manageable. So maybe if you would probably either change your connection or maybe just speak slower, that might help. So while we wait for Dr. Nita, please remember you can ask questions and join the conversation at www.slido.com and just use the hashtag WHWC to ask your questions or comments. So over to you, Dr. Ntia.
Can you hear me now? Is it better?
Yes, very good. Thank you.
Fantastic. So, Lola, thank you very much. I said there's no need to buy one more suit in my life anymore. From now till I perhaps turn 60. Number one. Number two, that there are only very few things that really matter. I think COVID has, for me, as someone who has managed a 30,000 person organization from a COVID management control perspective, and then for someone who has also suffered COVID, last year, I've come through those experiences with a very clear understanding that, frankly, increasingly, there are very few things that are really, really that important. We don't need one more suit. We don't need one more car. So much more, as Wally just pointed out earlier on, that so much more can be achieved by just focusing on what really is important. And if you start with the why in anything you do, any kind of role you have in your organization or as a person, you find that indeed you weed out the fluff, you weed out the fat so much faster. What I've learned is that all of us, wherever we sit, wherever we work, and however we interact and produce for organizations, must ask ourselves what's the real purpose of either our roles or our entire outcome in our organizations. And when we got that put together, you can find that you can attack that delivery of that outcome or that purpose, in so many ways that makes it not necessary for you to always be present or physically present. I run a large department for health in a large organization that is in the energy industry. And for me, we are the ones that have to stay in the office when others are working from home, because we have to run the defense centers and run the control room. But even with that, we see that very deliberate terms that people taking up time to work from home or go on leave, forced leave in some cases. And I realized that we were probably much more productive than we were when everybody was in the office. And that just made me realize that all my latest hires, when we hired the office to help run our systems, we found out that our biggest need was for somebody who sounded good on the phone, had good person skills, rather than your nursing competence or your medical competence, frankly. You have to sound good, speak good English, and communicate clearly on the phone. And that became a big lesson for me that our competence is changing, and the needs changing of even my own health organization. And therefore, the needs we need going forward in the current and in the immediate future are going to be significantly different from what we've known in the past 5 years and beyond. So back to you, Lola. Those have been my big reflections. And around productivity, Lola, please continue having meetings in the kitchen, continue having meetings in bed with your loved one next to you and all of that, knowing that you're in a meeting, but your arm is still draped around your loved one. I find that this work-life integration is something we must not take lip service to. For those that are always switched on, have to work from home, always find a very deliberate schedule to spend time to exercise, even as you're working. With your AirPods, earbuds, or whatever it is you have in your ear with your phone, join those meetings while you're walking, while you're running, if need be, or while you're doing whatever it is that you're doing that gives you physical activity. Also, be deliberate to spend time with your loved ones. Spend time with people, your children, your loved ones, your partner, all of that. Think about that time in the work day. And at the same time, attend to all your emails, respond to all your messages, make all the phone calls you need to make, and then stay away from fluff. Just don't clutter yourself with too much false information or things like that. And I think that we'll live more meaningful lives, more purposeful lives, and achieve better outcomes. Back to you, Lola.
So thanks, Dr. Ntia, and congrats on beating COVID. So I just wanted to quickly comment on something because you had already started on it. Clearly, we're having challenges disconnecting, and you alluded to that in your comments. But we're also seeing a rise in diseases associated with lifestyle choices. And there's also the sense that we're already an over-medicated generation. People in their 20s are already taking blood pressure meds and all of that. So in addition to what you said already, can you just quickly speak to what should organizations do differently? Because you've given us the insight as to what we should do. So take our meetings around loved ones, but what should organizations do deliberately? So if you quickly speak to that, please.
So again, Wale made a few very clear succinct points that even as organizations, we should stop metering our people or appraising them as per where you clock in and where you clock out. As a matter of fact, one of the things I had with a very good friend of mine who's a GM of a sister department in my organization was he used to go on and check who has logged on, who has not logged on, to know that people who are working from home are still working. And I asked him that you're fooling not just yourself, but your subordinates as well. The key thing is connect with them for purpose. Find out what are we doing, what are we delivering, which project is important, which value is on the table. We've got those clear, everybody understands that. Let them find their way to plug in. People work from home in different ways. There are some that can give you 5 straight hours as a burst. There are some that need to do 1 hour, get up and go and do something else for 1 hour, come back for 1 hour. The key thing is everybody knows what they're contributing to the table. And don't set up more meetings just because you want to look as if you're being busy. Meetings are, frankly, they negate your productivity. So organizations need to be very careful and very clear about what matters to everyone. And very often you'll find at the end of the day that the entire way we look at our deliverables must change. The second one is that every organization, if they didn't have that before, must have a robust health and wellness, deliberate, fit-for-purpose program for today. What that means is that, for example, in my organization, one of the things we've done is set up an online virtual leader dashboard for everybody. So everybody, please, on your own, exercise, log on your steps on this virtual dashboard. Everyone, fill on there's a mental health matrix we have. And once you go on there and fill it on per time, it assesses your level, what they call mental well-being index. So the MWI gives you an idea of where you are per time. And from time to time, everyone is encouraged to feel something. It's voluntary. And then also, there are deliberate virtual delivery of resilience sessions that we do deliberately. So we encourage you to attend each one. If you miss one, there's a next one around the corner, and everybody gets to be able to connect. And then we actually invite non-medical people to lead those sessions. So mental and psychological first aid should become such commonplace things as someone knowing how to apply a band-aid. So, and we want people that are non-medical to get the basic understanding, just to connect with it, and then be able to spread that gospel. So these are some things that have been done deliberately at policy level and at strategy level for organizations, large organizations like mine is quite large. And then you come back with that into some simple microcosms and get everybody involved. So as an organization, my last point around this is that you must be deliberate. Look at your population. Find out those who can do things without having to necessarily be present. And don't make them feel guilty for not being in the office. I've seen some people where that is right. Make them understand how much more productive they can be, and don't measure it in number of hours. Measure it in outcomes. Give them opportunities and enable them to connect. And
that is,
back to you, Lola.
That is really helpful. Thank you for that, and appreciate the fact that you also shared insight you are doing as an organization. So there's no theory there. It's all tried and tested. Thank you. So Emma, you are obviously invested in learning, training, upskilling. And as we've heard already on the call, there's a mainstreaming now of topics that were probably not things you heard in the business world. Empathy, diversity, inclusion, purpose, compass. So those things are new or alien. Well, no longer really. In the past 12 months, it became mainstream. But then there's also the challenge that business executives somehow in these parts are struggling to understand or actually commit to people over profit. So in your view, what are the immediate skills that you think executives need to hone or develop to enable them lead better in these times?
Thank you very much, Lola, for this question. Well, I'll start by saying, first of all, that I'm very happy that with COVID, what COVID has done is to move away the emphasis from the generalistic aspects of HR to the behavioral and psychological aspects of HR. It used to be that when you tell people in those days, I'm an occupational psychologist or I'm an organizational behaviorist, people would look at you funny and ask what it is that you're doing. But now COVID is upon us, and there is now a need for us to pay attention to these things and for leaders to pay more attention to these behavioral and psychological aspects of work. All right, burnout is real. We're talking about productivity increasing, but as productivity is increasing because people have started to work from home, there is also a commensurate increase in burnout rates and in stress rates and in demotivation and in disengagement. These things are happening. We're also beginning to get reports of violence at home, increased violence at home, drug abuse, so many negative issues that come with burnout. So MDs need to pay attention. Leaders need to pay attention more to this. You said it that in these parts, it's not normal for us to, for leaders to generally pay attention to things like empathy, kindness, diversity, inclusion. It's just not been our way, all right? But if you were to ask me, what are the things that we need to start to teach leaders? I think we need to start to teach leaders about authentic leadership, all right? Leaders have to be authentic about what it is they're doing. Don't be afraid to show emotions. You just have to understand that you shouldn't be afraid to show emotions. You shouldn't be afraid to be transparent. And you shouldn't be afraid to show people that you're going through your own stress as well. I mean, Dr. Nsikak just talked about going through COVID, all right? We've had a number of leaders who have experienced COVID, a number of people who've gone through COVID. So it's not a big deal anymore. We're all in this together, all right? So that's the first thing. Leaders need to really develop that skill of authentic leadership, all right? And then leaders need to also understand the importance of human resources and really giving human resources management, all right? A seat at the table, all right? It's time for us to really begin to get that seat at the table, all right? And it's time for HR to be carried along in the decisions that companies are beginning to make, all right? But it's not just enough for us to get a seat at the table. We as human resource practitioners and organizational behavior practitioners and organizational psychologists, we also have to learn how to speak the language of the business, all right? So it's not enough, for instance, for you to tell, your leader that, you know what, we've done a survey, the feedback that's coming in is that burnout is increasing, stress is increasing, demotivation is increasing. The leader is probably not going to listen to what it is that you have to say. When you say to your leader, you know what, burnout is increasing and studies show or information is coming back to show us that for every person that is burnt out, we're losing 30% of the salary that we pay to that person, all right? Then probably, it's not probably, your leader is definitely going to listen to you. Look, people are demotivated, they're disengaged from work. And this is how much we're losing in terms of revenue as a result of people not being tuned into work. So these are some of the things that we are really going to have to start to see happening. Leaders developing more understanding about how to be authentic and adaptive to these sorts of situations. And it's not something that can be glossed over or overlooked. We've just seen recently that a CEO in one of the big fours in the UK lost his job recently because he told, he was on a meeting, was a conference call with his employees. And what did he tell them? When they started to complain about the fact that COVID was really having an impact on their lives, he said to them, please stop whinging, stop moaning. And what happened? Somebody was recording it. It got out, it was put on all the major social media platforms, and before you knew it, a career was destroyed. So basically speaking, that in a nutshell, we'll get to talk about this more, but that is in a nutshell is what I think that we should be looking at.
Thank you so much, Emma. So, Sadina, let's get back into, you had mentioned some things in the course of speaking that one of the lessons you have gleaned from this experience is the fact that organizations need to stop being lazy about how KPIs are set. So I want to then focus on performance management, because after all, we are talking about productivity. So 2 questions for you. Is performance management as we now know it obsolete? That's one. And then how would you then track productivity in an era where you can't see your employees? You can't even dock pay because they were late to work. You know, those things traditional HR did back in the day to enforce and exert control. And then your dress policy is now really just a policy because people are doing high-powered meetings in all kinds of fancy gear and fancy clothes and all of those. So what is the future of performance management and even assessing or rewarding productivity in the future workplace?
Okay, thank you very much, Lola. First thing I should say is it's not a one-size-fits-all. So from industry to industry, you have different demographic. If you take manufacturing sector, for instance, where I operate and most of our business subsidiaries are, the percentage of employees that will work remotely is limited. So you have manufacturing factories where people have to be physically present to manage material flow and conversion. Then you have people in all kinds of janitorial services and cleaning and so on and so forth that could not be doing their jobs remotely. You have the construction industry as well. But I understand that service industries, telecom, banking, and a host of others can comfortably have 90 to 100% of their jobs done remotely, apart from cleaning and janitorial services. Now, what happens to productivity and performance management? Performance management, in principle, is not changing. What is changing are the tools and the processes. So unlike before, when a lot of the activities are conducted face-to-face and sometimes on hard copies, paper-based, for organizations that have not embraced the digital platform. Now, with the experiences we've gone through, at least a full cycle of performance run, a full year had been completed in this pandemic experience. It is clear now that the tool, the platform for performance management, for those who have been left behind before, will have to shift to digital now. First thing settled. Secondly, what the conversation that I used to hold face-to-face, when we used to struggle to find time and venue to have the performance conversation, from objective setting to the midterm reviews and the year-end reviews, all of that is now going to give way to more or less daily interaction through the digital platform. We're having a conversation now, and I have people that I manage remotely, even before the pandemic, and so do you and so many others. The difference now is that approach is going to be expanded, and more, managers will have to embrace that approach for managing performance. I mentioned earlier on that organizations have been lazy at setting clear, measurable KPIs, simply because they could see things physically and make comments and make adjustments. That is going to change now. If the KPIs are not smart enough, measuring them remotely and assessing them remotely will become a big problem. So performance will no longer be a matter of attendance and punctuality and appearance and so on and so forth. It is not going to be KPIs that are tied to projects, that are broken into small bits that are manageable. So I don't have to, people have recommended so many ways to manage your teams. They talk about you log on in the morning and the person logs on as well and checking on you and you checking on them, and you do it midday and you do it at the end of the day. Look, what this experience has taught us is that beyond the job title, the salary, and the big offices, people value their freedom, the freedom to use their own creativity to deliver the outcome that you desire. So checking in on people, honestly, we phase out with time, because what people are really interested in is, tell me what you want from me. I think the laziness of most line managers in the past had been, even we are not clear about what we want from people and we couldn't articulate it to them. When you do that, when you articulate it accurately, clearly, in a measurable way, the people will run with the freedom that you've given them. They will give you more than what you are even asking for. And you don't need to check in on them and monitor them as if they're babies to check whether they're at work or they are not at work. They are at work anyway, 24/7. Their brain has fully integrated their life, their play, and their work together. What they need from us is clarity of what we want and the freedom for them to apply their creativity to deliver. Apart from those who are junior workers, factory workers, construction workers that have to be physically present at the location of the work. Thank you.
Thank you very much. So again, audience, remember, you can join the conversation via www.slido.com. Use the hashtag WHWC. So Dr. Ntia, I want to just bring you in now to speak to some of the insights from Mr. Wale's notes. So this is the most wired or connected human civilization has ever been. But yet cases of depression, isolation, burnout, even suicide is increasing. And of course, mental health is no longer a buzzword, as we know. So really, from a practical point of view, and just give us like four clear insights, what can corporate leaders do right now to prioritize wellness as they do their company financial? So I know you've talked about strategies, but clear now, because today someone else, tomorrow is someone you didn't envisage. These things are getting closer. We're connected, but we're not connected. So how do we do all of these things?
I think one of the first and most important things that as well as put on the table, actually, and Emma as well, is to first of all begin to remodel or almost like, reframe our thinking. The first of them all is that the most important single factor I have found in my own, I've done occupational medicine for something like 18 years. And in those 18 years, the biggest single differentiator, is about how engaged and included people are way before the pandemic. And one of the biggest single ways to unlock engagement is purpose. And I know it's like people bandy purpose around, that purpose is their life and all of that, but in this context of work, in the work context, allow people to connect with the why. I'm almost in a Simon Sinek sort of advocate of start with the why. So up to your driver, You know, your driver has to know that he doesn't just drive you. If you work like I work in the energy sector, for example, he's putting hydrocarbons in the places where it can power this country. He's contributing to that. If the cleaner in NASA that definitely ran into said, no, you're not cleaning the ground in this building, you're putting somebody on the moon. So once they can begin at whatever level, whether it's in Pidgin English, in Yoruba, in Ibibio, you're connecting to that lowest level, connect. Spend much more time and energy connecting. And when you get to that level of connection, you find that, that I think it was Emma that made the point about their creativity. People begin to come in with their innovation. People come in with their own. Once people begin to be able to innovate at whatever level they are, and you got to that level of point, go to sleep. In their own way, they will give you superlative outcomes. They will give you discretionary outcomes. And it comes back to that point about how we appraise. And big point about being clear about what you need from them. What are the true outcomes you need? If people are not in the office, what do I still need? To deliver this project, what do I need from your neck of the woods? So that's one side of things, around that kind of insight. That's what kind of needs to be done. So while we know that there's been a rise in all of that, I think we should be careful about a couple of things before we take them as gospel. The first of them is that one of the reasons I am very against quarantine is that in the pandemic scenario and in epidemics that we've seen around the world, way before COVID and now with COVID, is that the quarantine measures actually trigger much more psychological side effects than the disease itself as a pure virus or epidemic in itself. When you quarantine people and force restriction, there is some element of the human nature that rebels. And it rebels internally first. And then you begin to get pervasive collective anxiety, pervasive collective apprehension, pervasive collective anger, actually. And there's all of these that trickle down into higher post-traumatic stress scores, post-traumatic depression, active stress disorder, and those kind of things. I don't want to get too medical here. But one of the key things that to all of that is that, for example, in all around the world, the Swedish model was one I found most intriguing, and we may be able to look back after another year and say they were the most successful because they refused to go, mandatory quarantine. They felt that I would empower my people with information and services to provide them to make smarter choices. So I'm saying it might not be good to go to a football stadium. I'm not saying I will close the gates, but I don't think it's a good place to go because you may contact the virus. And then the person decides. I don't think it's good to ride in a bus that's full of people. I think then the person decides. I agree they have a lot of awareness, they have a lot of festival sort of mechanisms, but as a principle, they were more focused on empowering, which is more sustainable, than militarizing. And for us in Nigeria, our default is militarized. Put the decree, run it through. What we must do more as organizations is to think through these things. No matter how much more time and pain it takes, connect with the why. Let them understand why. Then give them simple tools. For example, the drivers in our logistics team, for example, have to come to the office to drive. There's no way they can do it remotely. They have to drive whatever vehicles are still moving. But even in that context, some of the things they have to come in to do to check and all that have been made possible for them to do online. So they only came to pick up vehicles and go for those in the pool. And then there's also a system where those that were in for a time could be housed in a place that has good COVID control. And then they drive, when they go off work they drive for a week, go off for a week, another group comes in. Because the number of vehicles they use were fewer than before the pandemic. Just be creative. Yeah.
So sorry to cut you midstream. I got a note that we're sort of rounding off. And you touched on purpose. You talked on the fact that, isolation is not your preferred. Now, there are a group of individuals who, even if they wanted to isolate, they have sort of statistics have shown that women have actually carried the burden of a lot of coping with this time. So, Emma, for solidarity purposes, I'd like you to answer one question quickly for me and then also take your closing remarks in that same response. So, women with children have come under increasing strain as a result of juggling. We would sort out the home, sort out work, and then there's homeschooling. So as you take your closing remarks, really, what practical strategies do you think organizations can adopt to be more empathetic towards the extra burdens that the female employees carry, while you also give us your closing remarks? Thank you.
All right, thank you, Lola. I think there's too much emphasis on what organizations can do for women to make things better. I think the women themselves have to stand up for themselves and start fighting for their rights, okay? I think we underestimate what our collective bargaining power as women, all right, is, okay, if we come together as women, all right, in a group, I mean, women currently constitute over 40% of the, labor force in Nigeria at the moment, okay? And I think that it is important that there's more power in a collective voice rather than in a single voice, all right? It is important for us to come together as women and start bargaining for our rights, okay? And start insisting on our rights. We cannot, it is impossible for us to say that a woman is going to get up from the way things are constituted right now, that a woman is going to get up, work from 8 o'clock to 8 o'clock, and then you ignore the fact that there's so many things going on around in the background, okay, that we never used to be conscious of before, all right? So there's got to be that collective bargaining power. We've got to start negotiating our work hours, all right? We've got to start negotiating when and where we work, how long we work. Studies have shown that it's not about the length of time that you work, it's actually about the quality of work that you deliver and the value of work that you deliver, all right? So that entire conversation has to start going on. And we've got to communicate the fact that we're going through issues, all right? And that we need people to listen to us and that we need people to support us and to help us. So it's not just about organizations providing support for women. I think it's got to move beyond that, and we've got to aggressively take the bull by the horns and start to negotiate for better work terms for women, given the current conditions that we're facing in this pandemic.
Thank you so much for those insights. So, Mr. Adediro, definitely haven't saved the best for last, but as my guy, I reserve that honor because CIPM things here. So practical strategies now, because you are obviously leading a large conglomerate with large headcount. What low budget initiatives can be implemented to promote mental health in the workplace? And then please just take your closing remarks with that as well. Thank you.
Thank you very much. And what I'm about to say is applicable to all workers, not just the women, but also the men. First thing is organizations must shift from the mentality of regimental structure for work to a flexible mental state that gives freedom and empowerment and meaning to employees. So when we talked about flexi work arrangement, it's not just for those who can work remotely, even those that will have to be physically at work, like we did in our factories. We allowed the employees themselves to come up with plans that will ensure that some can stretch themselves for a short burst of time and then have a longer period away from work. And then they form themselves into smaller clusters, smaller teams or sub-teams that would work together. In a factory, you can't avoid working together in some areas. And for those who work together to stick together so that some other clusters can be off work for a longer period. And God forbid, in case anyone gets infected in a cluster, we will not lose the entire operation. Others can step in. So organizations must realize that things have changed. The changes have brought a new measure of freedom and also a new style of engagement that helps productivity, and employees will not give it away. So both the organization and the employees must embrace this new flexibility that gives more freedom, that gives more understanding and meaning to work, and enables both sides to show empathy that helps the businesses and helps the employees. So if an employee, for instance, has additional goals to achieve out there, be it parental, educational, what have you, the flexibility that is possible now can make those things happen. It's a new world and we must embrace it. Thank you.
Thank you so much. I love that conclusion. It's a new world and we must embrace it. So listening, audience, again, just to thank you for your participation. I'm sure you would agree with me that we've gotten very diverse and insightful perspectives on really how to handle productivity and mental health in a situation where we're always plugged on. So just want to again say thank you to the esteemed panel, Dr. Ntia, Mr. Wale Adediran, Emma, for sharing so freely of your insights. And of course, as usual, to Business Day for being the front runners in terms of thought leadership on how to enhance the workplace experience. So thank you so much, and have a good day. Continue to stay safe. Thank you.
Thank you very much, Lola.
Thank you very much, Mrs. Lola, as well as all the participants of that panel. Thank you so much. It was nice having you. Now we'll go straight up to a presentation for about 15 minutes. It's going to be by Dr. Uganze Eke, the CEO, Choose Life Limited. Dr. Uganze.
Ladies and gentlemen, indeed, it's been a pleasure being here and listening to all the amazing insights and all the learning points this morning. I've been taking notes. And I want to encourage us to continue to listen because we are going into a totally new segment here. My name is Dr. Ogai Eke, as introduced, and I am the CEO of Choose Life Limited, a subsidiary of Fitness Fair Limited. Fitness Fair is a health and wellness and lifestyle change company. And she was born out of a passion and recognition there was something that was missing in the healthcare system. And that is the focus on preventive health practically. I mean, we've talked about it, usually has been more curative than preventive. And usually when we hear preventive, we talk established protocols. But what we do is slightly different. And that's why I'm glad to be on this platform and in this conference. So what have we been talking about? I like what Mr. Adediran just said, and I'll quote Lola as well. It's a new world and we must embrace it. So what does that mean for us? We've been talking about just one thing, health, good health, and that remains unchanged because every single person here is able to be productive, is able to work, is able to live and feel like there's anything worth doing only when we have that one thing, health. COVID has changed things. And in Nigeria, I think it has really woken us up. And I hope that it truly has woken us up because I sometimes back and I think, what is our hope really? Our hope is still not very clear if we're looking at what the government has on ground for people to go and get proper medical care. I'm talking about our public hospitals or even our private hospitals. So we're still challenged. And I've been listening to a lot of the speakers today. So if your company is not one of the established ones with deep pockets to have proper structure in place, what do you do? And that's why I am very glad to be here because there are two things that has driven the reason why Choose Life and Fitness Fair was created. And one is that we must solve our problems in simple ways. Find a way to be able to make preventive health something that we all own. I personally say that with all the drama around vaccines and all the drama of getting or taking one thing or the other, our best immunity remains your immunity. The ability to build your body up with all that it needs to be able to stand firm when there's any onslaught, whether it is COVID or it is hypertension or whether it is Ebola, whatever, your immune levels, your ability to defend yourself is still your best vaccine. The second thing is that we must be able to develop the accessible tool that is cost-effective and very, very easy for anybody in Nigeria or beyond to be able to get that help. So I have 15 minutes to speak, and I'm about to share some slides, and I'll just take it from here as I open up my presentation slides now. Okay.
I'll share screen. I hope everyone can see my screen. All right. So we have a vision. I have a vision. Imagine that you would have a Nigeria where the life expectancy is at least 85 years. 85 years. It's happening in a lot of countries. I personally am tired. I'm sick, forgive the pun, of hearing the facts that keep going south, especially with this COVID pandemic. And if you're someone thinking of the solutions that we can apply, when you see numbers like this, it keeps you awake. 60% of Nigerians are still suffering from hypertension. And I must say, many don't even admit to themselves or know that they are even sick. So these numbers, I believe, are still underrated. We've heard a lot about mental health and the issues in the workplace. We've had how so many people are dying of cancer and other diseases that are preventable, even diabetes and stuff like that. The workplace cannot be productive if focus is not given to these issues. So I am happy to introduce to you our tool, our homegrown tool that has been developed since before the pandemic, incidentally. We were thinking about this deeply, and we decided that it was time for someone to bring something that you could use at your fingertips to be able to have good healthcare. So welcome to our vision and our solution for tackling this problem. And I am happy to introduce the Choose Life Wellness Platform, which is a wellness platform that empowers both the individual and organizations with the data and the tools and the life-giving skills and resources they need to improve both their mental and their physical well-being. Our mission is simple. We just want people to be empowered. Cure ED. Everybody needs to have that knowledge, that ability, the simplicity and the ease to sustain good health. So we created this platform so that we would be able to not be limited by space or any other challenge that is common to what we normally have, as obstacles, especially finances. If an organization could on a tool like Choose Life, then you can be sure that it's easier for them to commit to driving wellness and engaging people in their wellness work, in their workplace, as well as in their homes. So how are we hoping to do this? We want to be able to do this by what we call the Choose Life pillars. Every strong house or any skyscraper must be built on very solid foundations. And so we have the 4 pillars of wellness. We say you need to choose your good health. And this is about the medical numbers that we have. You have to be empowered to know them, what they mean, and check them periodically. Somebody has to probably prompt everyone at some point. Have you done your annual assessment? What are the results? And then give a tracking so that when things begin to change, it's easier for that staff to begin to notice that things aren't going quite well. And so we also have the Choose Fitness. This is a platform that would give you the access you need to certified trainers and methods and tools that would work for you, not just to jump into any fitness program because you think that everybody else is doing it and you can jump into the bandwagon. We actually have a unique tool that assesses your fitness levels first before you're able to continue and know what works for you. We also have the Choose Nutrition, which speaks to your personalized meal planning. It's not every dish or every food that is good for everyone. I personally have come to recognize that a lot of Black people, for example, are intolerant to things like nuts. Many of us are not tolerating wheat products. And yet, when you see someone who's diabetic, you hear some nutritionists quickly rush you to the wheat-based swallows. And you see cases getting compounded. So here we are drawing attention to what actually works for you because we have certified trainers. And finally, we have the Choose Life, the Choose Lifestyle. These are what I call the intangibles, the sleep management. Of course, we all know now there's a sleep pandemic. With the digital remote working, many people don't sleep well anymore because the bosses are sending mails by 2 a.m. You wake up in the morning, your box is full. There is stress that is coming at us from a totally different angle. So here we are trying to navigate, helping people with the right tools to be able to find a way to manage their wellness realistically. And so why do you want to choose life? So the individual, it's clear. I've mentioned all that is possible within this PAR system. But more importantly, why should other partners join us in this work? It's because we remain a value add for HMOs, and I've heard a lot of HMOs speak here today, and I know a lot of them offer corporate wellness programs, but not the way we do. In fact, we take them time. We bring cost-benefit values to their offerings to clients because we actually focus on giving you the right tools to keep people healthy. So what we do is not something that is replicated by them. We know that, yes, they can offer health talks and offer, advice here and there, but we actually go into the individual's lives. Personalized information. We tackle the individual one-on-one, and we are able to give them the guided plans they need. So for corporates as well, a lot of our problems have been getting understood that what we do is different from what HMOs offer really. And here, I think with all that has happened with COVID and the need for each and every person, like one of the speakers said, to be handled individually, makes it even more important that they engage us as partners that will bring value to their system and deliver wellness, bottom line. So I know that a lot of people are wondering, how do we get this? Where are we going to have this? I think it's important to know that we are offering a lovely promo to everyone who is attending this conference today. And it's my pleasure to say that if you want your company to experience this beautiful platform, just drop us a mail on chooselife@fitnessfairng.com, and then we will respond because we are going into our beta testing phase from the 1st of March, 2021. And we are leaving it open for free for 1 month for any company that is interested in looking for that, which would actually solve problems, to come on board and to be able to enjoy Choose Life for their staff. Thank you very much. If there are any questions, I will take them now. Okay, so I have a question, and someone says, how do you personalize nutrition? Is it by blood type or genotype or by what parameters? I have seen different nutritionists, and I'm not sure what the science behind the nutrition specification is. Very, very good question. I know that there's a book called Eating Right for Your Blood Group by a doctor, and he has done a lot of work, and he has tried to come up with this theory that because you're of a particular blood group, that the blood group will determine what you actually eat. You see, the body is unique to itself. There is no one size fits all for anyone, and that's why what I do is personalized. By the time our nutritionists work with you, they'll be able to define, and this can be totally online, because by the time you bring back the information they need, they'll be able to send you for specific tests, and then you'll be able to get what will work for you. But I find one thing very important though, a lot of us do not know our bodies. One of our fundamental principles here is that we know ourselves. You first start with a proper understanding of your medical numbers, and then you understand all other nuances that are making you genetically predisposed to certain things. And from there, you can build on it. Personally, I suffered a lot from a lot of health issues, not knowing it was something that came from as simple as groundnuts. I ate groundnuts all my life. I had skin problems. I had bowel problems without realizing that I was just simply allergic. And finally, in just resolving that simple issue, A lot of things, aches and pains that were so unnecessary were resolved. What is the issue? Has not been about my blood group, but because I failed to pay attention to identifying some triggers. So this is what makes nutrition very beautiful and very unique. You must have what works for you. I hope that answers your question. And if there are no other questions, I think I'll hand over back to the program organizers. Thank you, Business Day, for this opportunity.
Thank you so much, Thank you so much, Doctor. We really appreciate the presentation. It was very lovely and insightful. I'm sure people benefited from that. So we'll move straight up to the final and last panel, panel 4. And it has the topic, Managing Emerging Psychosocial Risks in Workplaces, What We Now Know. This is a very interesting topic that panelists are going to do justice to. And to anchor this panel, we have Mrs. Lola. We have Mrs. Lola Esson. She's the Director of People Advisory Services, Ernst & Young Africa. Mrs. Lola Esson, please, the room is yours now.
Thank you so much. It's good to be back up, and thank you, Dr. Eke, for that presentation into what's possible when it comes to managed health services. So I think the next topic is one which, I had the opportunity of moderating a previous session, and we talked about some of the things we're seeing around, obviously being always connected and switched on. But at a deeper level, we're sort of seeing this dovetail into psychosocial risks. And it's important that we then begin to look at what else can we do to sort of address some of these risks from a point of mitigation right now until it becomes a full-blown crisis. And to do that, I think so perfectly selected is a team of medical practitioners who again would be bringing different perspectives, but most importantly, sharing their expertise on what we can really do to identify and manage psychosocial risks better. So hopefully with this panel, we'll be looking to moving beyond, yes, COVID-19 has happened, we're dealing with the challenges, but how else can we now begin to address some of the psychological responses we're seeing in the form of low mood, low motivation, exhaustion, skin issues, there's been so many problems. If I chronicle what I have gone through from month 1 to this date, I think I agree, and I'm actually looking forward to what I can do better and differently. So please join me in giving, well, in this case, it would have to be virtual because I know you cannot go off mute. I'm welcoming again Dr. Oganze Eke, who is the CEO of Choose Life Limited. We had the privilege of hearing her speak shortly ago. Dr. Olayinka Atilola, who is a senior lecturer at the Department of Behavioral Medicine in LASU. Thank you, Doctor. And then finally, Dr. Silvanus Jato, who is a medical consultant with Stanbic IBTC PLC. So you can see that the panel is one that is diverse. And as usual, we're looking to glean some real insights as to how we can address the situations before us. So I'd want to dive straight into it by, first of all, maybe asking Dr. Atilola, what are some of the hazards that you see? So beyond the ones we can already talk about now that we've identified, what are some of the hazards you see that are lurking around with regards to psychosocial risks? And how can organizations begin to assess these risks and hazards, especially with remote working now, where people are at home, but these risks are there and they're pervasive and it's increasing. So how can we begin to actively go after not just identifying the potential risks, but also the mitigating strategies for them? Dr. Atilola, please. Okay, while we wait for Dr. Atilola, because we do recognize we might have sound challenges, I probably want to maybe immediately just ask Dr. Silvanus to speak to this next point I have. So, we're positive, right, that we've made progress with vaccines. A lot of people are putting up pictures on social media, first shot, second shot. Hopefully we too will get ours soon. But that said, we would return to work whether or not the vaccines get here and people are opening up. So what really should be the standard company response or protocols for preventing outbreaks, for managing outbreaks, and then how do we even safeguard the return to work for recovering COVID-19 patients? So they've recovered, but we're still a society that has stigma. Oh, he had COVID, she had COVID. So how do we make sure the workplace is not even contributing to some of these psychosocial problems that people are experiencing? Thank you, Dr. Johnson.
Yeah, thank you. Well, it's a pleasure being here. I want to thank Business Day for giving us the opportunity to speak to these very contemporary issues that the COVID-19 has brought upon us. Definitely, people are quite concerned. At home, they are concerned about how safe they are in their home, but you know that they have control over their home, who comes in and who goes out. But at the workplace, they are even much more concerned because apart from just themselves and their colleagues coming into the workplace, others who are coming to do business, the clients will also be coming in, and they're all coming with the same, with different, what I would call either COVID-19 signals or footprints of where they've been. So as an organization, it's very key. And of course, over this 1 year plus of COVID-19, organizations have learned along the way. It's been a learning curve for every one of us to put in place a protocol that continue to ensure that. So you still have to fall back to act on what have we done as an organization and how effective has it shown that there are minimal intra-office transmission of COVID, even during the first wave or second wave. It therefore shows that those protocols are working for you as an organization, and therefore you need to strengthen those protocols. In the earlier panel, where Funke Amobi, the head of Market Capital for Stanbic, spoke, we mentioned about our 3R response, which was the rapid response, the resilient response, and the recovery response. During the rapid response, was more awareness creation while creating the learning to create the right protocols of work. Okay, so we talk about the symptom checker. People, you have to be sure those coming into your office space are actually healthy, and they've actually tick off those questions that actually could point to ill health. And those who are ill are therefore kept away from the office. So you can be to some extent say, everyone coming into my office are healthy as and when they came into the office space. And of course, when they come into the office space, the checks prior to entry, and of course, the protocol within the working space have to be continually enforced, and people are encouraged to adhere, wear your face mask properly, frequently use hand sanitizers, wash your hands frequently when you have access to soap and water, and continue to do that. And of course, what you want to do is to put accountability. People should be responsible, ensuring that everyone within that office space continually to keep to those COVID standards and protocols, while at work. And of course, you put movement within the office space. So when you get to the office space, of course, you reduce the population at the point or reduce to 50% capacity to provide for social distancing within. So you've done that. But even much more than just that, that when you provided by the social distancing, physical distancing within the office, you must also ensure that there's maintenance of distancing, that there's no frequent movement, either between colleagues within the office space or those who come from outside into the office space to transact business, so that the chances of transmission is reduced. So keeping the office space safe becomes a total responsibility of everyone. That's why we talk about our taking responsibility engagement that is cascade down. This from the communication coming from the C is cascaded to the business heads, to the unit heads, to the team heads, and down to the line managers or supervisors, and to their direct reports, to ensure that they continually keep abreast with those standards. Of course, where you now have, if for example, you have a case of COVID, then begins to be, okay, the possibility of exposure to that case of COVID in terms of if they are working from home, of course, that chance is not there. However, if they be coming to the office, then you begin to know, have they been consistently checking their symptom checker? If they have, the likelihood of coming into the office and being very ill and dispersing the virus is limited because the symptom checker would have sieved them out. And of course, we know with COVID-19, during the incubation period, it says that within the first 2-3 days, the rate of the transmission or of releasing droplets that we have the virus is a bit lower than later to the 50 to 70 days. So picking out through the symptom checker like we have stamping early people with symptoms. We actually have say that look, listing out specific symptoms that if you have any of these symptoms, you shouldn't come into it. Even if it's a sneeze, until you've spoken to the medical consultant who takes you through the entire evaluation to determine whether you should go to the office or whether you should go to the hospital for a medical check or whether you should go for a test. So with that, you're able to limit. And for when you now have a COVID case, you need to do the contact tracing. Then of course you need to self-quarantine those that need to be self-quarantined. Then you may need to at the same time also test based on contact. You need to know who have you. So it's a lot of work that goes in, but all these are what you do to keep the work environment safe.
Thank you very much. And thanks for that, for the strategies. I'm sure people are taking down comments. So dear audience, to participate in the conversations, please use www.slido.com and just use the hashtag WHWC to contribute with your comments and questions. So Dr. Eke, thanks for the presentation. That's sort of showcasing what's next for us in terms of lifestyle and wellness. But I just wanted to ask your perspective on something. So we've actually seen an increase in the demand for online personal training. I mean, I know at work we had a syndicated fitness session, and that still runs for all Africa employees. So it's quite interesting to think that you can attend a group workout with people in different countries and time zones. So we're getting better at this technology thing. So looking at the fact that we're now working at home under hybrid models, we have, well, not that we have a bit more time, but at least we can probably juggle our schedules to accommodate some of these things. What opportunities do you see now for digitally enhanced corporate wellness, nutrition and fitness services in Nigeria? So I know you've showcased some of that already, but obviously you did that on the back of some insights. So where are you seeing this going? What sectors should be coming on board? And so let's hear your thoughts on that.
Actually, I think that's really the only way to go. Like prior speakers have said, the world is going digital. And whatever you need to do now, you need to think ease, you need to think of accessibility. But more importantly for me, it has to be something sustainable. The beauty of the thought that led to creating our own platform is that it's actually started before COVID. And the fact that I've been in this space for a few years now, and I've had to transverse Nigeria trying to do corporate wellness work the way we knew to do it, which was basically on site, and you had to do all the assessments, all the talking and everything. Each time I went to a location, what came back at us, was always, how do we continue from where you stopped? How do we continue to get this kind of guides and clarity, and who will motivate us? How will we be able? And I'm talking about normal folk, not big people who are just always like employed. People just want to have good health. And I realized that there was this huge ignorance gap. And so going digital, almost everybody has a phone now, or some means of accessing some information somewhere. And we've also heard that from prior speakers. So making it simple and something that people can easily click and get that information. I'm glad you gave the example about your group workout. Now imagine that we're able to talk to you as an individual with your own issues without even seeing your face. And it's working because we have different pockets of people already doing it, just that we are trying to bring it all to one platform and make sure that you actually have verified and accurate information. part of why it's so important to have something like what we're developing is because there's too much information flying. Since this whole COVID thing started, people have been told to go and drink their urine, swallow, rub yourself with salt, things that have been damaging lives more than bringing the health. But we're saying, get someone to actually bring that sanity to the platform. And going digital is just the only way to package that and make it homegrown. Because we also realize that a lot of people are using the imported ones, and our people cannot deal with the menu plans. They can't deal with the, so many things that are so unique to us as a people. So we decided to look inwards and try to solve our problems. So going digital, no going back.
I can totally agree with you. Sometimes kale looks nice on the menu plan, but when you realize that it's 2,000 for one leaf, ugu is a good substitute. So
absolutely.
Thanks for taking the homework.
Yeah. Garden egg leaves as well.
Okay, that's true. Thanks for that. So Dr. Atilola, welcome on board. Good to have you here. So we have not gone too far, but I just wanted to, actually, since you're in academia, wanted your perspective on whether the hazards lurking around the corner in respect of the psychosocial risks associated with this COVID, lockdown, all of that. Have we seen all of it? Or are there some that we probably don't have in our view right now? And really, how can organizations assess the risks, the hazards, who's at risk, especially now that people are working at home? So what would be some of the things we should be doing now? And have we seen it all when it comes to the risk factors associated with the psychosocial response?
Well, thank you very much. And what I can first say is that the issue of the psychosocial challenges that are associated with COVID-19, I can say that we have not seen it all. And in fact, the one that we are seeing, we are yet to even appreciate it in full. What I mean by that is that every day we are seeing different ways by which this COVID-19 has continued to affect usual schedules, and how this is spilling into our initially when this issue of working from home excited about the fact that, okay, so I will no longer have to beat traffic, I will no longer have to wake up very early, and they were initially excited. And naturally, somebody would think that that is something we can be excited about. But then there are so many things that happen at the workplace that we have always taken for granted. The social connection that comes with going to work. In fact, a lot of people have their main friend network is within their workplace. The workplace also provides us with an escape from some inconveniences that sometimes might be in our living environment, either in our domestic life, in terms of spouse relation, out in the back in the evening, provide some kind of meaning for people. When all these things
So Dr. Atilola, your connection is a bit patchy. So I don't know if you want to try, and yes, it's a bit patchy because we lose certain aspects. I think, okay, let's just see now. Maybe if you try to round off this particular, and then maybe you can then find an alternative. So I'll let you finish your contribution.
Okay, I'm sorry about that. I don't know why. And my hope is that you are hearing me now.
Yes, we can hear you. It's just that at some point you time off.
Hello. I need to be sure that you're even hearing me at all right now.
Yes, we can hear you.
Okay. As I was saying, so many of these effects have created a completely different psychosocial situation that we have not dealt with before. And we see this spilling out in our clinics where people come and they have different complaints about the fact that they are feeling depressed, they are feeling anxious, and that some of the things that they had thought was an advantage for them by reason of their opportunity to work from home, they have now realized that they may not have considered as much advantage as they have thought. So, and there are emerging trends that we are still seeing right now that we have not actually seen before. And such emerging trends include things like people that have problem with attention, whose attention span is a bit shorter than most people. They were able to cope because they work in an environment that is filled with other human interaction. But when they are now left on their own devices behind their phones or their computer, the problem of attention that they were having becomes amplified because they are now situated in a different context. They have mastered their attention within the context of workplace, but they have not mastered their attention within the context of several hours behind the screen. And then we've now started seeing people having problem of meeting deadlines, being able to keep even their schedule, some of which are no longer physical, but now, and then this brings a lot of frustration and a lot of anxiety and a lot of depression for them. So this is still evolving. And I think workplaces, if we have not invested in psychosocial intervention for employees, this is the best time for us to begin to think along that line. There is this thing that we've always talked about, which is the employee assistance program, in which employees are given an opportunity to talk to an expert on an online platform where they can address psychosocial issues that they have been facing. This has been something we have tried to popularize even at the level before the advent of COVID. But with the advent, it is even becoming more and more imperative. And I may also want to suggest that at some point in the course of our work, even with this new online system, we should also take out time when the discussion will not be about work, but the discussion will be about the psychological well-being of members of staff. The online opportunity have given us more opportunities for engagements that are not as laborious or as expensive as it used to be. But then we should take advantage of that to also attend to the psychological well-being of our staff. So the issues are expanding, the opportunities are there. It is for workplaces to recognize these issues and for them to invest in it. And one of those areas, like I said, is the employee program. We run an online platform for suicide prevention under the authority of the Suicide Research and Prevention Initiative, or otherwise called STOPING. And one of the feedback is that since the advent of this COVID, the number of calls on that line seems to have increased, and that some of them are related to the issues of life has changed since this COVID-19 started. And that is something that we have been able to do, but it's also something that workplaces can plug into, online psychological services for staff. It is actually imperative this time around with the advent of COVID and the ways it has affected.
Thank you so much for those insights. I mean, I definitely have learned so much, and thanks for the good work you're doing around, research and augmenting services that are available. So you said something now, which is encouraging organizations to do better when it comes to the psychological part. So Dr. Eke, I want to bring you in quickly to just address a certain perception. So there's the concept, or well, there's a suggestion that business leaders are still struggling to understand that it's now people over profits and not the other way around. So first, what's your view? And then how can we practically get business executives to prioritize the spend on wellness?
Very, very good question, Lola. I think that perception should have changed by now. I would say should, because you're hoping that people learn. But you know, man, a lot of times things happen, and then when things get better, they quickly forget. Now, the COVID experience has taught all of us that if you don't take care of your driver or your nanny, they will bring that disease to you in the house with all your precautions. So the need to safeguard your house or your environment has gone beyond selfish, thinking. Same thing for the workplace. If you want to be healthy, you have to think of the gate man that is saying hello to you, to your customers and to your staff, and take it all the way to the executive officer. So I think that ideally, people should have learned from the COVID experience that it is people that would make the profit happen. I wouldn't say over profit, but I would say taking care of your people, giving them the tools they need, ensuring that everybody is in good health would just mean greater profitability for you, bottom line. No matter how you cut it, that's just the truth.
Okay, it appears.
I would also say that to make it easier, but people need to also see that you don't building a new budget for healthy. What you would do would be simply have a wonderful tool to negotiate better premiums, for example, for your HMO, from your HMO, suppliers. If you have a good system where people are not falling ill, there wouldn't be any need for you to have the other extra expenses. If also people learn how to eat better, they actually save money. So there are critical, changes that must happen in the way we think to helping us realize that healthy living is actually a very, very good thing, and it's possible, and it can ultimately make your pockets better, whether for the executives or for the workers. But bottom line, I think the COVID experience should have changed our mindset that indeed it is better to invest in the health of your people and then see your profits, be maximized.
Thank you so much. So, Dr. Jato, obviously you work in a sector where there's a lot of regulation. And of course, risk management is like number one. But there seems to be the suggestion that when it comes to psychosocial risks, it oftentimes is not considered part of enterprise risk. And I think from the insights we're hearing from this call and even previous sessions, it's become as important as you would the other risks. So what would you recommend would be some of the priorities corporate leaders need to begin to adopt when it comes to putting psychosociological risk management as part of your ERM framework? So what should they do differently? How do we go on board, even equipping the CRO, the Chief Risk Officer, to begin to plan, mitigate, and identify some of these risk issues?
Yeah, thank you very much. I think every organization at this point will definitely realize that psychosocial risk is a very important risk in business. And for our own point of view, I've been in the financial sector and with all the regulations, we realize that you really need to have a well-rounded, holistic, healthy workforce to meet up with all the regulatory requirements required from your regulators. One thing about the employee assistance program, which tends to address this aspect in terms of how the workers are able to handle the related risks from this COVID-19. The practice of employing assistants is very new in the Nigerian corporate space. The Employee Assistant Practitioners Association of Nigeria is barely probably 2 or 3 years old. For us as an organization, our own EAP framework, and I've been running for over 3 years, since 2018. We have developed a framework for employee assistants that help to address psychosocial, that help to address mental, psychological, and social issues, because when we talk about regulators and other organizations, probably not as highly regulated as this, what comes with sanctions, what comes with the regulatory sanctions are mistakes or inadvertent commissions made by employees. So if you've not paid attention to help them to be well-rounded and well holistically taken care of, then they are bound to be making these errors. They are bound to be, falling short on these regulatory requirements, and it is the business that that it affects. So the business ability to meet regulatory requirements is as strong as the weakest link in your entire team or in your entire business units that work. So it's very important that you pay attention to sector, and every organization must invest. And now, as the employee assistant practice begins to evolve and grow and strengthen and more. When we started in 2018, it was really very difficult getting the people with the right expertise to deal this area for corporate clients like ours. In fact, it was we would have started earlier, but it was really getting the right framework, with the right setup, with the right knowledge and know-how on how to confidentially handle these issues that will be coming on board when you provide access to this type of counseling sessions and help and support that they need, until we're able to get service provider who were willing to lend the rope to provide it. Remember, confidentiality is very key in handling this issue. So first of all, it's not just enough to say I have an EAP support platform to help workers achieve this support, get this support. Will they access it? Will they have confidence in accessing it? So when you design your framework, you have to embed it. You have to train line managers to be able to support. You have to get employees to accept it and be willing to use it. And of course, over time, as they begin to see the confidence in it, they begin to have trust in it, they're able to use it. And it ends up helping the business to be sustainable, helping the business to avoid those regulatory issues. So as a business, every business must sit and define what their risks are, define what some of these risks are related to psychosocial issues, and be able to provide avenues for them to be addressed, and over time begin to get the confidence of employees to use those support systems to overcome, and therefore are much more balanced and are much more in tune with the business realities, business strategies, and therefore are able to execute for the success that the business will have at the end of the day. So a business is as good as its ability to manage these risks and get the necessary support for the employees. Thank you.
Thank you so much for those comments. And it's very important to, I think I like the fact that you have enumerated steps that organizations can focus on. But Dr. Silva, I have a question for you. Seeing that you are leading research in terms of the future of work and some of these risks that we see, I'm just a little curious. So you've mentioned that the challenges did not obviously start today, but are there probably some underlying root causes that we need to consider if we're trying to prepare better for the future and the implications of some of the outcomes of the pandemic? So what else is probably triggering the challenges we see that we probably haven't factored into the discussions or into our planning?
Well, thank you very much. I will illustrate with the example of the health sector in Nigeria. I just use that as an illustrative example. We've had a very weak healthcare delivery system in Nigeria. I believe that we have talked about it, but we didn't quite see, we haven't seen the importance of it until COVID-19 came, when our already fragile healthcare system was now put under a lot of pressure and it just simply buckled. What I mean by buckling is, okay, we need to, for instance, in a clinic where 50 to 70 people try to access, we need to do social distancing, and then we reduce the number to like 15. And because it is that the 70 that is accessing that system in the first instance were the lucky ones. There are hundreds of people that were not able to access it. Now, when COVID-19 social distancing regulation came, it reduced significantly further. And of course, the problem only got worse. We were not prepared for all of this. And if we now come to the issue of psychosocial issues and interventions, the same way we were not prepared for our basic healthcare delivery system, we are not prepared for psychosocial intervention, either at workplace or in any other, even our private lives. So with the advent of COVID-19, it just simply caught us unawares, and everybody is just running at us. So for the purpose of the future, what we need to understand is that issues like this, including a pandemic, is not something that is far-fetched. It is something that can happen again. In fact, it is in the course of this COVID-19 that we realize that not longer than some 50 years ago, we've actually had a kind of pandemic, maybe not at the level of the COVID-19, but we've had situations where people had to stay at home, where people could not go to their places of work. So this is something that we have dealt with in the past, we are dealing with now, we will deal with in the future. And so based on that, we need to begin to look at how did this affect us so that we can use it to plan for the future. And some of the weaknesses that we saw in the system, in the psychosocial intervention system for Nigeria, is that one, it is not adequate to start with. We have not invested in mental health, either at the workplace or in our public life. And the little investment that we have made did not factor in the risk of explosion. And also it didn't factor in a situation whereby people cannot see their interventionist physically. So many of our services were usually one-on-one contact based. We have not developed infrastructure for e-health, including e-mental health. Yes, there are pockets here and there of services, but to make that a system so that for every physical mental health service that we have, there is also an online option. And that those online options, people have been trained to handle them, and people that are likely to use it has also been trained on how to make use of such services. We had all those gaps, and in the course of this pandemic, several startups were coming up with electronic mental health services. But again, we ran into problem of both the resources for many of the service providers are trained in the delivery of mental health services, but they are not trained in the delivery of a mental health services. Because there are things that you also need to learn. If I'm sitting in front of you, or if you are sitting in front of me, I am trained to read your body language. I'm trained to read nuances. But then I need to retrain myself to read those same body language and nuances when I'm speaking with you on an electronic platform. So many of these things, as the pandemic is either winding down or not, we need to continue to develop our e-health and e-mental health infrastructure and develop it as if we are going to have a pandemic every day. so that even if it recalls back to physical mental health services after the pandemic, we have it at the back of our mind that this issue of electronic delivery of services has come to stay. It is one of the weaknesses that we have. Because I work in a major hospital, and it is just in the course of this pandemic that we are starting for the first time to have a platform where people can book appointments, can receive basic services online. So that is a weakness area that I think.
So, Dr. So I think that is definitely very heartwarming news that in a public facing institution, we now have those provisions. And I think just to acknowledge the work that leading researchers, entrepreneurs like Dr. Eke, the HMOs are doing in terms of ramping up in such a short period of time. So I think we need to begin to bring this to a close now. And I just want to quickly then give the opportunity to Dr. Eke to answer again, not because, but just because I get the note that we need to wrap up soon. I mean, it will be important to hear your thoughts on what are the opportunities arising out of COVID-19 to build a psychosocial safety program into the workplace of the future. Because I mean, from what Dr. Tula has said, they are making broad strides. I've acknowledged the role of the HMOs and even institutions and organizations making those changes. But we should not just always think gloom, right? So what are the opportunities you see coming? So if you can please just maybe mention some and then take your closing remarks, and then we go on to you as well, Dr. Jato, maybe some suggestions to add, and then also your closing remarks. So let's try and do that in maybe 40 seconds each. Thank you.
Thank you. I think one of the greatest opportunities would be a need to structure new behavioral patterns that would help ease the stress with this new dispensation. A lot of things have been going on and nobody is really actually sitting down to look at how to structure new ways to work. Like a lot of the HR practitioners are talking about it, but we need to now have like a global way of streamlining work. It was easier when you could go into work at 8 o'clock and know that you would leave at 4. And so you mentally prepared for it and you had those breaks that you needed that wouldn't overwhelm you. But now, like I said, we have people constantly working, especially if you have a predisposition to want to be a perfectionist, you want to be on top of your mails, you want to be on top of every assignment you're given. So we see this new onslaught mentally messing people up. So I would think that a great opportunity would be for looking inwards and for every institution to begin to define and structure new ways to streamline the stress that is coming from the workplace. The second thing is the opportunity that it offers to practitioners like mine, where we need to begin to take preventive health seriously. It's not just about the preventive health of taking the vaccines and all that. We're talking about taking good care of yourself. A lot of young people especially are not sleeping, for example, and they don't even get it. But we know that this is one of the risks to leading to what we've been discussing here, psychosocial issues, the mental issues, because people are just looking down on something as simple and as key as sleeping well. So I think there are a lot of things. Boost your immunity, find a way to structure and change jobs if you have to for things that would help you survive. That would be my greatest contribution.
Thank you so much. Dr. Jato, in 40 seconds, your own contributions, what are the upsides of us now really working on things in the health sector and in response to the COVID-19 threat?
Yeah, thank you. I think the opportunities are very wide. One is the fact that it's opportunity for organizations to let their human capital, the most value assets, know that they care so much about both their physical and mental health, and therefore begin to make sure that they provide platforms for these supports to come, not just enough to work and be present at work. The second opportunity that is open is opportunity for the business to develop a program that work with their partners, like our HMO, our own EAP framework has the handshake with what our HMO platforms are providing, which is Liberty and ACTA. There's a handshake, so the employee can either access on both platforms, either through the one the business provided or through the HMO. And at the point, there is a meeting point to ensure that everybody is working for the good of the employee. And of course, thirdly, like Dr. Ike said, look at using digital platforms to continue to drive wellness. We're doing a lot of that. We have wellness aerobics on digital platforms, wellness patterns on digital platforms. So to create, so that from wherever you are in this country, Nigeria, as long as you are starting that every Monday, Wednesday, Friday, you have a Zumba Tuesday, you have a Zumba class where you can join and continue to be physically active. Therefore, we have electronic platform for nutritionist support, dietitian support. If you are managing a chronic condition, you don't need to, you can speak to a nutritionist who will probably provide you guidance on how to help manage your chronic condition with a nutritionist or a dietary support for the better outcome. So there are a lot of opportunities right now, and every business must sit back and look at what they can do to support their employees. And this is the time to really let the employee know that they are your most valued assets.
Thank you so much. I mean, you will agree with me. This has been time well spent. I have learned so much. I just want to again thank Drs. AK, Dr. Atilola, and Dr. Jato for sharing so freely of your insights, the wealth of experience over the years. And hopefully we can also, you know, once this is over, we will begin to see a society where we're making good strides on the recommendations. And then, of course, not to forget to thank Business Day for putting together this well-organized, well-resourced thought leadership event. So at this point, we've come to the end of our session, but I would now like to invite Dr. Olga Okiti, the MD of Business Day, for his closing remarks. Thank you so much, and continue to stay safe, everyone.
Thank you.
Thank you so very much, Lola Esson, for moderating the last panel session, and even the one before it. Is truly been most very insightful and very helpful discussions as well. So as we come to a close of this Business Day second annual Workplace Health and Wellbeing Conference, for which we have been looking back at the last 1 year, the implications for the health of our colleagues, our staff, of course, for everyone in the workplace, including their families, and of course, the responses and roles that businesses play, and even the opportunities that that the last 1 year has presented has really been demonstrated in this long but very helpful conversation today. So one important thing for me before I say my thank you, one important thing that resonated all through the panel sessions, every speaker conversation, is that our human resources are the most critical part of the company, the business, or the nation, and we should take care of it. That just kept coming from speaker to speaker. When you are healed, you can't work. Whatever it is that you want to do, once you are healed, you can work. So it's very important that we look into workplace health. And of course, it is only when we do that that we can begin to drive productivity and profit. And that is the message that I take from the conversation today, and I thank you all. So let me now say my thank you first to my speakers. Sorry, to our speakers. They have demonstrated immense expertise all through the conversation, from the first panel to the last panel. We had very great speakers talking through their own experience and using their own practice to give us the lessons that we should take from. I thank you all. I also want to thank all our moderators. The role they played is immeasurable, because they were able to coordinate all the conversations for us to arrive at these very important conclusions. So I thank you all. Finally, I want to also thank our sponsors. We are so grateful for the sponsorship that we have received towards this conference. So I thank you all. Once again, I'll mention them. I thank Total Health Trust. Total Health Trust, that's an HMO company. Assad Mansard Health, I thank them. Choose Life Limited, thank you. And of course, Lafarge, which I did not mention in my opening remarks, but I thank you. I thank you. We thank you for your support. And to you, our audience, thank you so much for staying with us here today. And I really do hope that you will join us again in one of our conversations as we normally have in Business Day. Until then, please have a great afternoon, a great Business Day afternoon. Thank you and God bless. Bye-bye.
At Business Day, we help investors as well as business executives, professionals, bankers, lawyers, and government policymakers around the world to get access to authoritative business news and financial intelligence. We are a trusted and award-winning media platform providing superior business, financial, and management intelligence across Africa for entrepreneurs. Through our global network of business journalists and partnership with The Economist and The Financial Times, we equip you to get ahead of the competition. To discover a world of business opportunities and intelligence that keep you ahead of your competitors.
Delight was actually started to tell innovative, exciting, and positive food stories out of Lagos, Nigeria.
Being the foremost luxurious goods company in the entire West Africa is a big deal.
Will you have every opportunity? No. But you see, the opportunities you lose on account of your value system, that's your opportunity cost for what you believe, and is the price you must be willing to pay.